Doctors of Reddit, what's the biggest case of faking it you've ever seen? Posted this before but male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs. When I hear something interesting, I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying breathe. No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in. After receiving the oxygen, I look at the kid and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her, and she is literally blowing spit bubbles. I check her reflexes, everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, ECG, reflexes, pupils, etc. point all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and she's conscious, but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit, where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for an nasogastric tube, which was inserted and then removed by her in a matter of minutes. Young, 18 to 20, woman went running into small rural hospital pretending to have abdominal pain. Police officer had tagged her going 40+ km over the limit, which was "stunt driving" as per the new law in Ontario. Impound and license suspension automatic. Cop followed her into a and apparently said he'd be waiting for her. When she left, locum staff such as myself were housed at a small B&B about 15 minutes away, and the had pre-printed order sets to be done before we arrived. When I arrived, she flat out admitted that she just came in because she freaked out and didn't stop. I told her we'd give her 45 minutes to call her parents/family before I booted her, except BHCG came back positive, and subsequent ultrasound came back showing extremely early ectopic. Officer figures out something is up when he hears air ambulance call coming over radio. She was completely asymptomatic and just worked out that she dodged both charges and a life-threatening issue by accident. It was definitely a what the fuck moment. Edit. Well, this blew up overnight. I got a few messages, a little more info. Small rural hospitals in northern Ontario often service areas from more than an hour's drive away and still only have a catchment area of 2,000 to 3,000 people. When on call, it was just that. We would do our days in the community clinic, then maybe hospital rounds, then go home and be on call. We wouldn't be at the hospital. There wasn't an on-call room where you would stay, for example. There were lots of times that you'd go a full night without being woken up, or maybe just a call from the acute care inpatient wing. Locums were short-term contracts for places that didn't have full-time medical staff for whatever reason. It's hard to attract clinicians if you don't even have broadband internet in the community. They generally pay very well. Not a doctor, but am a UK-based midwife. Had a patient who had been in and out of hospital throughout her pregnancy with episodes of heavy bleeding. This was her 6th baby, so she was a fairly well-known patient in our unit. The issue was no one had ever seen her actively bleeding. She'd call saying that she had bled down the toilet but flushed it, and all the examinations we did came back completely normal with mostly no evidence of any bleed whatsoever. On occasions during speculum examinations we'd see the smallest amount of blood. I was caring for her during a shift where she yet again called to say she was bleeding, walked into her room, and found her jabbing around her vagina with a sharp object to make herself bleed. She had been doing it the entire pregnancy. The reason she gave, because she had 5 noisy children at home, needed some rest, and knew we wouldn't admit her to hospital if it wasn't for a good reason. She would do it any time her being discharged home was mentioned. We ended up having to complete a perinatal mental health referral and consult with the safeguarding midwives as she was putting herself and baby at risk of serious harm. Edit. So this got a lot more attention than I ever expected. There's a lot of questions regarding birth control and questioning her parenting, so thought it best to add an edit. This patient was not by any means a benefits seeker. They were a hard-working and loving family that had full-time jobs. She had been booked in to have her tubes tied, but found out a week before the procedure that she was pregnant with this baby. She just couldn't cope during the pregnancy and became very mentally unwell. She did not realize the implications or understand the face that she was causing massive harm to herself and her baby. She was referred to our perinatal mental health team and treated for psychosis. They also had a lot of input after she had her baby. She ended up having a C-section and was sterilized at the same time at her request. By all accounts she is doing very well now. Also thank you very much for the slivers. Late to the thread so this will probably get buried, but I'm a resident, not a psych resident, but this happened in my psychiatry rotation in medical school. When I was in medical school, there was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch. To check her medical records, it turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist, and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria. Not a doctor, but worked in healthcare for nearly 20 years. While taking a break from the ICU, due to it being emotionally draining, I worked in home health for a bit. I had a patient who clearly had Munchausen syndrome. On a daily basis she would call her insurance to see what things would be covered if she was diagnosed with this or that. She called her doctor's office an average of 5x during my shift with her. She would report all kinds of non-real symptoms. She pestered the doctors into do exploitive laparoscopic surgery. Of course nothing was found. One day I walked in, and she was rubbing her incisions with rotten cabbage trying to get it infected. She wasn't seeking pain meds, except to sell. Really she was just as happy with antibiotics or stool softeners, anything, as long as they wrote her a prescription, and she got to go to the pharmacy, where she did a whole song and dance for them too, claiming allergies and reactions. She always increased the exaggeration of her story too. One time she fluttered her eyes after making sure I was looking and said she lost consciousness in that half a second. She called the doctor and claimed she lost consciousness for 5 minutes. She called the insurance and claimed it was 10 minutes. She called the pharmacy and claimed it was 30 minutes. Then she called 911 and told them she woke up on the floor after losing consciousness for 4 hours. The worst thing about her was she was a mom. Her son was 28 at the time, and by all the stories of his childhood illnesses and all her saying how he is severely disabled, I knew she basically faked up his childhood with Munchausen by proxy. She portrayed him as being severely disabled, and that's why he would never find a wife. I met him. He was healthy and of average intelligence. He wasn't looking for a wife. He was gay, but she refused to accept. That point, working with her was so miserable that I took a couple years off from any and all healthcare after that. I'm an M document. Lots of weak pseudo seizure stories. Those are fairly common. Some of those people are straight up seeking fourth benzos, but most are people with seizure disorders who have some psych issues and are coming by it honestly. They are just sad, confused people who don't know how to handle stress for the most part. Point, I've seen all sorts of weird people faking symptoms. The most devious was a guy I'll call Steve. Steve had to be in the medical field somehow. Probably a nurse or tech. He was fairly tall and skinny. He claimed to have Marfan syndrome, a rare connective tissue disease that makes you tall and skinny and puts you at a higher risk for an aortic dissection. You can think of aortic dissections as the main pipe carrying blood starting to break. They're bad. Steve didn't only claim to have Marfan's, he stated that he had a dissection in the past, and it was done by Dr. BFD at BFD Medical Center, real surgeon and real institution. I'm removing the name. He then would come in with a classic story for dissection. He'd say he had a tearing chest pain radiating to the back. Point, Steve took it to the next level. He'd flex his arm when the blood pressure cuff was on one arm, then relax on the other. This caused vastly different blood pressure readings in each arm, and this is another classically taught finding in dissection. In addition to this, the bastard would say that he had an anaphylactic reaction to contrast dye. He did this in an attempt to force us to pre-treat him with Benadryl and steroids, which took 8 hours. During those 8 hours, he'd request opiates after opiates before getting his CTA done. He also would get nauseated, requesting Phenergan. Point, for those who don't know, 4th Delor did Phenergan, and Benadryl is the best ride the hospital can really put you on. They all potentiate each other. Highly reviewed by opiate junkies everywhere. Point, I got Steve on his 3rd visit. The 2 prior visits showed no dissections. Steve was dumb enough to come in during normal business hours, and I managed to get a hold of this surgeon. Surgeon said he'd never taken care of the guy, and that he'd gotten multiple calls about him. Point, I still offered the CTA to the patient. I told him he'd be getting 0 opiates though. He left in a fit. Point, fax Steve. No one has seen him since. I'm sure he's at some new hospital now. I'm a nurse. I work in acute rehab, so patients come to us to do physical therapy and recover from surgeries, illnesses, etc. Had a patient who played us good. Point, so this dude was ready to go home and medically stable, but very anxious. He would always ask for me to recheck his vitals and blood sugar, always come up with new concerns like his hand is twitching, or he feels dizzy, or he's having blurry vision. I thought I was pretty good at ruling out his concerns and calming him down. Point, then one day I check his vitals and his pulse is quite low, like 48. Everything else is good, so I'm not concerned. I tell him I'll recheck in a few minutes. I come back, and he's looking not so good. Pulse still low, oxygen quite low, and he's just woozy and slow to respond. I get my charge nurse in, and we are worried about an opiate overdose. We discuss this, and the patient's breathing gets slower and shallower. Call the MD, give him some Narcan, call EMS. They arrive and now he's nearly unresponsive, barely reacts to the sternal rub. They give him more Narcan with no effect, so now we are thinking rule out stroke. He has the slightest droop on one side of his mouth. Was that always there? Damn, did I miss it? I give them report, and they rush him to the hospital, where they do a very thorough workup, because he's high risk for a lot of issues. We followed up the next day, and nothing was wrong with him. The faker must have heard me mention his pulse, and said this is my chance. I think he held his breath when I took his O2 sat, and started dropping his mouth once we mentioned stroke. Probably skipped lunch, since his blood sugar was low too. All because he didn't want to go home. Now he's banned from our facility. Pediatric neuropsychologist. Got a referral for more or less consolidation care. Patient was 13, wheelchair bound, required therapeutic oxygen, seizures, arthritis, musculoskeletal problems, suspected autism, completely nonverbal, severe behavior challenges, the list goes on. He was being followed by at least 8 different specialties, clearly none of whom were communicating with each other, and med list was 18 prescriptions long, including some incredibly heavy duty stuff, opioids, antipsychotics, anti-epileptics, that sort of stuff. Got kicked to me after his umpteenth third trip because the doc felt something was off and he needed someone to look at the whole picture. Factitious disorder by Karagiva, or Munchausen by proxy. All of the original symptoms were parent reported, going back to about a year old. It had possibly started with a febrile seizure, fever-induced seizure, in infancy, but this was never witnessed by anyone but mom. It's unclear. She had been telling docs different things. She was convinced her son had all these disorders, told him he was going to die any day. He got a Make-A-Wish trip, donations, etc. He was removed from her custody and taken off most of his meds. Within a few weeks he was out of the wheelchair playing basketball, no oxygen, super talkative and friendly, no behavior problems. He did have a pretty significant intellectual disability, but there's no way to say if that was organic or the result of the prescription cocktail he had been fed all his life. Hopefully with some good therapy and a stable home, he can continue to make progress. Not a doctor, but I've 25 meters. Got a story point. I was raised in the Cook Islands, which is a very Christian island and set in the old ways. One of my friends, 25 meters, used to come over to my place to study. I was a naughty kid growing up, and one Saturday night he came over, and we drank a whole bottle of Bombay Sapphire. We were 14. On the Sunday his mum came over to pick him up for the morning church service. On Monday he didn't show up to school. 3 days went by, a week, 2 weeks. After 2 weeks of his absence I called him, and he told me the funniest story. When he went to church the day he left, he said he had to throw up, so he ran out of the church to a tree and threw up. His mum saw and threw him in the car, and took him to the hospital. Sidebar, his family was the type to disown a family member for having sex before marriage. Back to the story, he gets to the hospital and throws a fit, because he doesn't want his blood tested. The doctor just diagnoses him based off of his symptoms, and says he has the flu. Gets sent home, and is feeling ill for a week straight. After that his parents are convinced he doesn't have the flu, but he instead has dengue fever, which was going around the island at the time. He refused treatment, and stayed home pretending to be sick the entire time. After 2 weeks he was able to return to school. It's been 11 years, and we still talk. His family still thinks he had dengue fever to this day, when in reality he was hungover, and probably got alcohol poisoning from our Saturday night bender. He still won't tell his mum. I wasn't faking, but got accused of it and it almost killed me. I had pain in my leg when I was 8. As long as I was distracted I didn't really feel it, but when I was lying down I felt it more. So I always complained when I had to go to sleep. My parents thought I faked it for weeks. They took me to a doctor who checked my leg and found nothing. Told my parent I was faking. They believed the doctor, and it went on until I got my parents to let another doctor check it, because it was getting worse, and I started being in pain all the time. We went to multiple doctors and some specialists and all of them found nothing in my leg, until one of them thought I might have a disc prolapse, and checked my spine. Turns out I had a big aggressive tumor in my spine that was putting pressure on my central nervous system and that caused the pain in my leg. Got rushed to the hospital and got chemotherapy. They couldn't perform surgery without risking my life. It got rapidly worse at the beginning, to the point where I was paraplegic. Got pain meds over the maximum they were allowed to give children, and it still hurt so bad that I begged for death. I got really lucky and the chemotherapy worked, was better than the doctors expected, and I survived, and it only left a small issue with my foot. Years later my parents told me the doctors had said that I had maximum 2 years to live and no chance of surviving. Had the first or even one of the first doctors realized the issue, it would have saved me 2 years of suffering. Sometimes people err in faking it. Not a doctor. I suffer from intense migraines. Been hospitalized multiple times over my life. Thousands upon thousands in debt for hospital visits and procedures. Still have them on a regular basis. When I was in 3rd grade, we watched a movie in class one day. That movie was Where the Red Fern Grows. Towards the end, when one of the dogs die and the other is mourning and waiting to die, I couldn't take it. I was bawling my eyes out, like uncontrollable crying. I told Mrs. Mahan, I think that was her name, that my head was killing me, that I had a migraine. She took me to her little office and she called my mom to come get me point-side bit. I was known for being brutally honest early on. Once I couldn't pup, and my mom told me I was constipated because I ate too much cheese. I was in Mrs. Mahan's class and I went to the bathroom. I was in there for over an hour and she came to check on me. Not knowing any better, I straight told her I was constipated. She said okay and left me alone. So from then on, if I told her anything, she'd straight take my word for it, point back to the story point. So she called my mom, who came and got me. When we got home, I went right outside and started playing with my 2 dogs, Charlie and Jake. Mom called after me and questioned me immediately. I thought you had a migraine. You seem fine now. I told her why I was crying, and my mom, being a massive animal lover, smiled and said she understood and let me go. Point to this day. Fact, that movie and fact Old Yeller. That one they showed us in after school care when I was in 4th grade. That one I hid in the bathroom till I stopped crying. Who the fuck shows those movies to kids? I know doctors have most likely seen their fair share of people faking, but doctors do need to take people's pain in consideration and believe them. Point, I got a strange throat infection. I couldn't swallow and couldn't breathe because the pain would feel like hot rocks. I didn't want to go to the ER, so throughout the day I ended up taking 16 Advils that didn't touch the pain at all. My appendix burst and I can say it was less painful than this tonsil/throat infection. All the tests came back negative, and they had to check my blood to see if my liver and kidneys were functioning properly. After taking that much Advil, point, they sent me home and told me to take more Advil. Cue to the next day, the pain was so bad I went to the ER again. Thank God that doctor believed me and prescribed me some antibiotics and a steroid shot that got rid of the pain within the next few hours. Edit. Another strange story. I got food poisoning and quite literally thought I was going to die. I don't know if it was because of the dehydration plus the pain of my intestines turning inside out, but my mom and boyfriend thought I should go to the ER, especially cause I had work the next day and it was 1 AM. They ended up giving me morphine for food poisoning, but couldn't give me any pain relief when I was in actual pain. When I was at boot camp in the military, I'm in Europe, we were having a 1-week survival drill outdoors in the wintertime. This was in the Arctic, so you knew it was going to suck. A buddy and me decided to report in sick with fever and went to the infirmary. Young civilian nurses did the triaging. One by one we were sent to a room with an old school thermometer covered in plastic and lube and asked to insert it in the backside. She left the room giving us a few minutes to insert it ourselves. That gave us a minute to take the thermometer out of the plastic sleeve, warm it on light bulb, and then desperately shaking it when it spiked beyond human temperature, getting it down to a reasonable fever temperature, and put the sleeve back on before the nurse returned, and we had proof we had a fever. We both did it and it worked. We had a few great days in the sick bay getting pampered by nurses, joking around and flirting with the nurses as awkward as 18-year-olds does. Every morning the doctor made his rounds, so we repeated the thermometer routine and blew hot air into the pillow to warm up our foreheads so they were warm and sweaty until Thursday morning. The nurse came in, gave us the thermometer as usual, and said the doctor would be visit in a few minutes. On her way out the door, she smiled and added, "And by the way guys, if you still have a fever, you will not be released until Monday because the doctor has the day off on Friday and there are no doctors here on weekends." We were miraculously fever free and healthy again and were dismissed that morning in time for the weekend leave. Point, thinking back on this, we were young and just wanted a few days away from the monotonous training and cold. And I still sometimes send a warm thought to that nurse, who obviously knew we were faking it, but played along. Not a doctor, but I was on the end of professional thinking I was faking it. So I have migraines that present as stroke symptoms. full face drop, left side paralysis, confusion, speech impediment, meaning I forget what words I want to say, and are slow to speak. Normally I catch it during my aura. On the occasion I don't manage to in time or I can do it waited out a few hours for the worst symptoms to go and suffer a few days of weakness and instability. So this particular event happened in uni surrounded by people who didn't know what to do or how to help. Despite my support worker telling them my needs and what to do for me, someone must have been concerned and thus paramedics were called, which always is the right call in stroke presentation. They arrive and begin their sets. I'm drowsy and have all the listed symptoms above. Obviously they thought this 21-year-old was faking it, so after trying to rouse me and getting increasingly annoyed with my faked illness they did a sternum rub. This is horrible to have done on you. I was coming back to normality slowly and them doing that action hurt, panicked me and I was scared. These men terrified me and were having a go at me for wasting time. They then made me leave the building to go to hospital. They wouldn't let anyone come with me either. Got there and was triaged as urgent and thus spent a while in the stroke ward because guess what? I wasn't faking it. My symptoms and tests indicated stroke, but probably wasn't. I was discharged after an overpass stay when all my signs had gone back to normality and a neurologist had a session with me. I don't have a diagnosis other than hemiplegic migraine point, so naturally I'm now scared of this happening again and people not believing me. And to be fair, if they had followed my support worker's advice it could have been avoided. Late to the gate, but this story always stood out to me because it highlights the extent some people will go to get opioids. I was working the general medicine floor and we were receiving an IQ step down of a 30-year-old guy who was recovering from diabetic ketoacidosis. What happens when your blood sugar is so damn high that your body fails? However, we know this patient very well. He will purposefully not take his insulin and eats terribly to go into DKA to get admitted to the hospital to get dilaudid. Supermorphine. Granted, DKA can give you horrendous abdominal pain, so we do give people pain control. Point, this guy's now out of the IQ, so his sugars are much better controlled. But he's in his room howling, grabbing his stomach. The nurses ask me to go talk to him because they just can't deal with his shenanigans anymore. I go in the room and the guy's wailing, doing the whole I want drugs act. Hey man, I heard you're in pain. Yes, I need dilaudid and these BHS won't give me any. That's very strong medicine. Let's try something less intense first. Have you tried Tylenol yet? No man. I'm in pain. You have to give me dilaudid. Well no. I'm going to give you Tylenol first. You're not going to give me dilaudid. No. Fuck this then. He stands up, rips his fourth out of his arm, and walks out the door. No paperwork, no prescriptions, nothing. See, I'm a nerdoc in a very busy public level eye trauma center. We deal with very sick people, but also a huge amount of don't need to be theirs. Our wait times for real rooms in the back can get truly atrocious. It's sometimes hard to not get frustrated with people, especially when they are actively faking it. One lady came in and had been waiting maybe 30 minutes. Original complaint. Flu-like symptoms for 6 hours in a 28-year-old. Triage nursing came rushing back with her seizing in a wheelchair. I get to her and she starts yelling, seizure. I'm having a seizure. Even without the obvious, we can usually tell pretty easily, but we can't. For a lot of reasons, including both other patient comfort and general optics. Have people in the lobby screaming and drooling and urinating. I ask her to stop, and for a moment she looks at me upset that I would even think to tell her to stop. She resumes. Everyone left the room for her to calm down, and she was discharged after history and exam didn't require further workup or treatment. She did demand new pants because she urinated during her episode. She was for some reason happy with that outcome. She jumped ahead of a new kidney failure, a high-risk chest pain, and what turned out to be appendicitis. The key is not getting jaded by it. An aside, non-epileptus seizures, focal seizures, etc. Do exist. We can tell the difference with pretty high reliability. Insert wasn't me, was my dad here. My dad is an ophthalmologist, and he often sees some crazy people, but this story belongs here. So, it was a Friday. My dad had a checkup with a middle-aged woman, maybe 50-ish. She said that she was completely blind and needed a walker thing. You could tell she was faking it to get them governmental funds, and there were 3 reasons that stuck out. When she walked in the room, she walked very quickly, barely using the walker, and immediately sat down in her seat, without feeling around. One of the things she said before she put her eyes in the viewer thing was that, and I quote, "My eyes might react to the light, but I can't see anything. The viewer thing uses intense light to see whatever's going on with the eyes." And this is the kicker. She gets a call on her phone and says, and I quote again, "I don't wanna talk my boyfriend now." She then swiped the decline slider. My dad prescribed her to a psychologist after that off-let it. Clarification. When I asked my dad, he said that you could clearly see the woman read the phone. Her eyes were moving from left to right when she got her phone out, he said. Thus, she was reading. Surgeon here. I just wanted to say that all the top answers are nurses for a reason. They have to deal with so much more bullshit than we do, and they filter out so much nonsense, so that the physician doesn't have to point. It is very much appreciated. And a special shout out to our nurses. Those brave souls deal with so much nonsense and trashy people. I don't think I could do their job. I'll tell my most ridiculous. From my residency, prisoner has an open wound into his abdomen that he's created over years by continually putting small metal objects that he confined into his abdomen. All the residents knew him because he did this so regularly. He had to have surgery a couple times to go get it out. When he came in this time, he demanded 4th morphine before he'd even let me look at it. I said no. He refused the exam. I told the docs and the guards with him to send him back to prison with it in. I wasn't going to do anything for him. So he went back to prison with a paperclip or something in his abdomen. Stupid games, stupid prizes. Yes, clearly he had mental issues, but he was normal acting and talking, and very much normal enough to know what he was doing, and was doing it routinely. I didn't just refuse to treat some deeply mentally sick individual. This was about morphine addiction. Not a doctor, but my friend is a doctor, and he told this story. Location, Hungary, some rural area. His job, along with a team of other doctors, inspect all people on disability pension in the region, and kick freeloaders out of the system. A lot of people obtained false documents claiming they had this or that kind of disabilities, taking quite a toll on the welfare budget, while they were obviously not disabled. Interestingly enough, a lot of them were actually quite muscled young men with gold chains as thick as a finger, driving BMWs and having frequent encounters with the police. As you guessed, many of these people were receiving a monthly pension under the most ridiculous pretexts. A couple of local physicians were later even indicted on corruption charges for certifying them as disabled. For example, there was a known local criminal who was running a meth distribution network, and he had official medical documents proving that he's mentally disabled and unable to sustain himself, literally needing a nurse 24/7 to change his diapers and whatnot. He even used it to get away with criminal charges. But not only major criminals were into this, a lot of petty ones too. One day he went to a house to investigate a guy who was allegedly so sick he couldn't even drag himself to the hospital. The house was better described as a hut, and the guy was sitting on the porch, seemingly in fairly good condition, smoking cigarettes and yelling at his woman, while a dozen kids run around. My friend walked up to the guy, introduced himself, and told him he doesn't look very sick. What is his disability? The guy immediately switched to a poor beggar's faint voice and said, "Oh, doctor. Indeed, I'm very sick, but what is your disability?" Me. I have heart muscle nerve epilepsy. My friend almost laughed out loud, not only because of this bullshit, but the way the guy said it with his retarded accent. For Hungarians, szívizom ideg epilepsia. Naturally he had his disability pension revoked. But my friend knew these folks well enough not to tell him right away, or he'd miraculously recover instantly, and the family lynched him. He only sent them a letter about the decision a few days later. At this point he had a script on his computer that imported all the names from the patient registry into Microsoft Word and generated rejection letters. After printing, he only had to find and throw away 3 or 4 of those who were actually disabled. The rest could be sent. A year later he showed me the official chart by the Central Statistics Institute indicating that disabilities in that region dropped by some 90% the previous year. Oh, I'm a psychiatrist and work with criminal justice patients. I have so many. One man faked Parkinson's to avoid jail. At this jail anyone who was unable to feed/clothe/toilet themselves was kept in the local public hospital until they got better or served out their sentence. He really did have a history of Parkinson's, and it took a day or two for them to get his meds. In the time his tremor came back, and he was unable to feed himself, so they sent him to the hospital, where he became my patient. His meds were restarted, but he claimed to still not be able to feed himself. However, if you left food on his tray and closed the curtain, the food would disappear. One patient faked cancer for over a year. He ended up in our and I saw him as a consult. He had 2 liters of urine in his bladder, which is too much. He said he had stage 4 melanoma, but the hospital where he claimed to be getting treated had no record of him. His dad and girlfriend were in the room when we confronted him, and his poor dad was so embarrassed. This man had his girlfriend shave his head, and they all went on a huge trip together. It was insane. He would text his girlfriend updates from the doctor's office while she was at work. His parents would give him rides to get his treatments. No one actually went in with him. They would wait in the lobby or the parking lot, which they didn't find super unusual, since he was in his 30s and said he wanted privacy. My attending said, and I quote, "You really are shit." We signed off on the case before they figured out why he had such bad urinary retention. I hope that girl dumped him. Car accident, very minor, but the women who got hit with her passenger said they were fine. They were clearly annoyed at the accident, very polite and nice at first but still annoyed. Guy whose fault it was, middle-aged, clearly lower middle class, but took care of himself, was a meticulously cleaned older sedan. 15 minutes later, women, after whispering with her passenger back and forth, walked up very matter of fact to me and demanded the fire department to respond. Few things to note. We were literally 50 steps away from the hospital, ironically near the entrance. During the day, everyone declined medical. When I showed up, said she was fine, she hardly knew she was even hit, point then demands fire. She can't walk, she's standing in front of me, and she must go to the hospital. I pointed the hospital out across the street, but still called. I had a good reputation with the fire guys, taught them the code for suspicious person and fraud call signal, and would discreetly relay to them via dispatch, who also knew what was up. Basically, I think they are faking it. Don't run lights and sirens. Sometimes not worth the risk. A fatal crash for a faker, and if it was real, anything major, I had a kit with me to take care of it, or would just carry her over. Soon as they arrived, she mentioned to her friend, "I don't care, he gonna pay for it." Poor guy was stressed. I told him not to worry about it. Point the length of my report was insane, and mainly in her after crash behavior, and she got a ticket for cutting the guy off. He still got a ticket for following too close after. No one realized there were cameras everywhere in that intersection, red light and nearby stores, and at that point I was gonna be petty and wanted all the video. Ruled no fault by the judge. Pretty sure she had to pay her own medical bills. Obligatory, not a doctor. Best friend's girlfriend faked pregnancy when he went out with us boys on a guy's night. When asked what she did with the test she took, she said, "I threw it out the window on the highway." Point my friend, an army field medic, asked pointed questions, feeling he knew she was faking, but she persisted that she was pregnant. Point they went to the doc the next day. No sign of pregnancy, past or present. Eventually, but far longer than any normal person would have persisted in the face of actual medical proof, she admitted to faking it. Point later, she did get pregnant. Cue an immediate marriage to my friend, since he has to do the right thing. Point after that, he went to his yearly 2 weeks of military training, and she moved out suddenly without notice with Jody, the guy she'd been seeing on the side. My friend came home and walked in his room and came back out with a flabbergasted look and asked, "Where is my wife?" So I told him she'd moved out suddenly. Point one paternity test later, and he divorced her and cut all ties because baby belonged to Jody. Point he dodged a hell of a bullet. Me personally, she'd have been gone after the first faked pregnancy. That's too nuts for me. I'm a nurse, and I've seen quite a few. It's really sad sometimes. These people are desperate for attention because there's something just lacking in their lives. The one that comes to mind the most is a patient who actually killed herself to keep up the lie. She had a hysterectomy at a young age due to vague pelvic pain. The surgeons had done several exploratory surgeries to try and find the cause, and found a single fibroid in her uterus, so they took it. Somehow the wound kept getting infected, so she kept coming back for dressing changes which necessitated Dilaudid before each one. Wouldn't you know, her dressing would fall off several times, requiring even more Dilaudid to replace. Every time she healed up enough to go home, she'd be back with raging infections. Eventually she had a colonic fistula, where a piece of her colon had stuck to her abdominal wall and wore a hole in it, so partially digested foods and fluids would leak out of her belly. Even then, dressings would fall off several times per shift, requiring Dilaudid to change. Eventually the hole was big enough we just fastened a wound manager attached to a drainage bag. One morning, the surgical resident told her she was well enough to be discharged to a long-term care facility. A minute after he told her, there was an all-hands alert to her room, because her wound was pouring blood. As we were working on her and getting her ready for emergency surgery, we found a bloody pair of clamps hidden beneath her body. She ended up septic and intubated/paralyzed in the ICU. Oddly enough, her dressings never came off them. She ended up in merely organ failure and dying. I remember the last conversation she and I had. She was talking about her sister who likes to pretend to be sick for the attention. Very tragic, but a diagnosis of Munchausen is avoided due to lawsuits. When I was in the military, I had really bad migraines. The doctor had me do a vision test, one of those machines you push your forehead against. Only the tech hadn't set it up right. I could see two sets of letters overlapping. I told the tech this. She told me to tell her what I saw. So I kept telling her this letter and this letter. The doctor got nasty with me, saying I was lying. My vision couldn't be that bad, or I could not have walked over to the med clinic from my work at the nearby dental clinic. She told me she was going to have to send me to get a very painful tap to my spine, because there would have to be very dangerous built up liquid pressure for me to fail that vision test so terribly. She told me she was going to call the ambulance to take me to the local hospital to have that excruciating procedure done, unless I admitted I was greatly exaggerating my pain and vision issues. I tried telling her what happened, told her to talk to the tech. I wound up doing the vision thing again. I told the tech again what was happening. The tech looked, saw I was right, they fixed something, so I did it without a hitch. The tech didn't fess up their mistake either, so the doctor felt she had confirmed I was a liar. I tried to switch doctors after that, but she kept switching me back to her. She put in my medical record following that event that I demonstrated I was a malingerer and could be costly to the military. Later on, she referred me to mental health after I started having pain in my left shoulder a year after a shoulder surgery, saying it was in my head. It took my arm coming out of the socket and turning purple, and my commander taking me to the med clinic himself for me to actually get looked at. Turned out the surgery had not been done properly, and my labrum was retorn, the original injury, rotator cuff was damaged, and the capsule was twice the size it should have been due to continued use. By the time they finally examined my shoulder it was 6 months after I first started having pains, and noticed it would pop out during physical training. I was a PT leader, I imagine. The doctor would probably tell my story on this thread, truly believing she was right I was faking. Prosthetist/orthotist here. Check username. We make a lot of different types of braces for people who have neurologic or orthopedic issues. I even make house calls for people who have trouble with transportation, which most do. Anyway, I went to a lady's house at the request of her doctor to evaluate her for AFOS, ankle foot orthosis. When I got there I knocked on the door and stepped back to wait for an answer. I didn't get an answer, so I went to the side of the house, where I saw another door under the carport. I walked by a large kitchen window and glanced in. As I passed I saw a woman walking through the kitchen. I knocked on the side door and the same lady answered the door in her wheelchair. I introduced myself and asked why she needed AFOS. She said she was paralyzed and had no control of her feet. She invited me in, and I was surprised to see that she propelled her wheelchair by using her feet to push herself around. I performed a manual muscle test and she presented with 0/5 on all muscle groups. This test is very easy to fake. All the person has to say is that they can't move, and there is no way to prove otherwise. She also said she could not feel me touching her skin, which was also a lie, based on how she flinched. I told her that I would talk to her doctor and then we would decide if she needed the braces. She was adamant she needed them. I talked with the doctor and he agreed she was in need of these AFOs, and she hasn't walked in years, so basically I saw a lady that claimed to be paralyzed walk in her kitchen and hop into a wheelchair that she controlled with her feet. She faked being paralyzed to get fit for braces that she had to pay for that she didn't need. Had a patient with Munchausen syndrome when I was a surgical resident. We got a call that there had been an industrial accident at the nearby Air Force Base, but for some reason the guy had presented to another non-military hospital first. Guy tells us he was cleaning planes at the Air Force Base, but that he was a civilian contractor. All lies, and somehow muriatic acid had gotten into his protective boots. Strangely, the dude was missing his left arm at the elbow. When we asked him about this, he said that was a long time ago. I don't want to talk about it. Short story is that he did this to himself by pouring some noxious chemical into a pair of wading boots he was wearing, which destroyed all the skin on his legs, requiring us to debride and eventually skin graft. But wait, there's more. He had not one, but two internet girlfriends whom he had convinced that he was part of a top secret military operation. He called them and told them he was involved in an explosion and had lost both his legs. Well, being the good, concerned internet girlfriends that they were, they came to our hospital to check on him and ended up very awkwardly meeting each other. Unfortunately for the patient, he apparently thought that we were going to amputate his legs to corroborate his story. Instead, we did a circumferential debridement and placed something called a wound vacation. The guy literally tried to convince the girlfriends that those wound vacs were actually experimental mechanical prosthetic legs that were a top secret government project. That's about the time that they left and never came back. That's also about the time that one of our senior surgeons recognized him and told us the story about his arm. Apparently, 10 to 15 years earlier, he had shown up after rubbing leather tanner on his arm and came in faking necrotizing fasciitis, flesh-eating bacteria. This led to the eventual, unnecessary, amputation of his arm at an outside hospital. Really sad case of severe mental illness, and a patient who I believe eventually took his own life, but the lengths this guy went to feign illness was like nothing I've ever seen, nor will ever see again. Had an 18-year-old female patient with a complicated medical history. She had over 30 drug allergies listed on her chart. She and her mother insisted this was because of a rare genetic immune disorder called mast cell degranulation syndrome, MCDS. They had many special requests which they imposed on the hospital staff because of this, including no use of foam hand sanitizer, no latex gloves, even outlandish things like no glitter allowed in the room. We went to great lengths to keep them happy, and her minor skin infection that brought her in looked fine. Things got interesting when I reviewed her chart and found a visit with a pediatric immunologist from about 5 years back. Turns she had extensive testing done for MCDS, all of which was completely negative. She was formerly diagnosed with a much more benign condition called chronic urticaria, which is essentially extremely sensitive skin. Said specialist clearly explained and documented this diagnosis, along with clear instructions for the patient to avoid dangerous medical interventions such as epinephrine. In other words, none of her drug reactions were true allergies, nor were they life-threatening in any way. Clearly they did not believe this diagnosis, and instead had latched themselves onto the much scarier MCDS despite the negative test results. I believe the root of the problem is an underlying psych disorder called Munchausen syndrome, in which one develops an overwhelming emotional attachment to the idea and role of being sick. She continued to demand referrals to other specialists, as is common with Munchausen patients. She now sees a hematology physician who believes her self-reported diagnosis of severe allergies and prescribes her EpiPens, which the patient self-injects multiple times per week. Worst part is that she is unlikely to live a normal lifespan. If the self-inflicted medical abuse continues, epinephrine can cause strokes, aneurysms, and other severe vascular issues if used irresponsibly, even in otherwise young and healthy patients. patient here. And have made amends with the doctors I made go through my own personal hell. I tried for about 14 years to kill myself. Gun, car accident, wounding myself with a knife, varieties of hammers, overdosed on pills, alcohol poisoning. Like you name it, I've done it. But I think the most embarrassing was when I was so low and my ex-fiance used me as his personal punching bag along with it, and then would play the I feel bad card and bring me to E.R after E.R to get pain meds along with the ones he was shoving at me that were his prescription, and having to lie saying I had passed out or fallen or was too drunk the night before, just anything to explain his marks. And after a while I finally had a doctor who cared enough to send him out saying something about a test that needed to be done in private, and he told me he's watched me for years and knows that it's not just me and my mental health and that something else is going on, because I was never asking for pain meds before this man, and I honestly was so defeated at the time I just asked him to leave and lied and said it was all my fault. Thankfully I'm years past that now, but I just wanted to post this so that some of you on here who laugh at us, and yes we may be junkies or faking it, there are some really horrible stories behind it. And even after I escaped only by him going to prison, when he got out this man kidnapped, drugged and raped me. I refused to go to the hospital after and just had my mom and ex-boyfriend take pictures for the police because I was 100% doubtful that I would be taken seriously. And because of that, and the fact that I couldn't give the police the name of person he got the drugs from, they dropped my case and said there was nothing they could do and I would probably be charged for falsely accusing him. I'm not going to tell the rest of the story because it continues to become worse after that, but I just wanted everyone to know before you laugh at someone doing this, even if they are mean or rich or poor or nice, whatever the case, we are not a funny story all the time, if ever. A scribe here had a patient come in with "severe respiratory distress." He was hyperventilating and just coughing up a storm. We got him hooked up to monitors, but he was hyperventilating so hard we couldn't get a clean waveform of his respirations, so his pulse ox would register as low, like mid-80s. Part of the emergency process is trying to get a and fourth line, but his veins are shot. So we attempt to get an IO. Intraosseous line. Basically when we can't get a vein for an fourth, we actually drill a hole into the shin to get access to the bloodstream. Upon hearing IO, this dude, who is apparently in "full-blown respiratory distress," becomes just lucid enough to refuse the IO and actually show us a vein on his leg that can be used. While he was showing us, he forgot to hyperventilate as hard, and a bit of clean waveform registered at like 98% O2 saturation. Doctor caught this, but the overall presentation was still concerning. During this entire ordeal, he's texting somebody on his phone. Eventually the decision is made to intubate, which is when a tube is put down the throat to aid in breathing. The doctor still had their doubts, but they decided it was better to act to save his life if it turns out he's actually sick. We intubate and he stabilizes instantaneously. After the intubation we call his family. They respond by basically going "lem guess" and proceed to describe the situation in perfect detail, including the hyperventilating, the low pulse ox, the eventual need for an IO that he would refuse, and finally the intubation. They told us that this dude basically hops from to feigning respiratory distress because he seems to like getting intubated. Apparently it's also due to the attention, but I shudder to imagine why he'd let it get to the point of intubation. Props for sticking to act, I guess. I work in the Before my story, I have to say that patients fake stuff all the time. Sometimes on purpose, sometimes they don't even realize it. It's usually pretty obvious when people are faking it. They don't seem to realize we see hundreds of people with the actual problem, so can tell when it's fake. This leads to the case of a guy presenting with concerns for tetanus. Spoiler alert, he was faking, but everyone bought it. Tetanus is also known as lockjaw and essentially makes your body go into severe muscle spasms that are very painful and can be very dangerous. It can shut down your respiratory muscles. It's extremely rare now due to vaccines. This guy had a perfect story though. His tetanus shot was overdue. He said he had stepped on a dirty nail within past few days/weeks or something, even had a wound and everything. He looked miserable and was following textbook presentation. Seemed to be in extreme pain. He almost got intubated in the Allergy, to fear his breathing would get shut down. He ended up getting high doses of pain meds and benzodiazepines, and admitted to the ICU for close monitoring and treatment. He was treated for days, as if he had tetanus, and had everyone fooled the whole time. But around day 3 or 4 his wife randomly shows up, and says oh he's doing this again. Yeah he does this sometimes, he doesn't have tetanus. And he essentially gets up, and leaves the hospital. Turns out he's trying to become an actor, and does this as practice, or a challenge or something. He had his own acting website and everything. Was both the most ridiculous / stupid thing I've ever seen, and also one of the most impressive acting jobs I've ever seen. In retrospect, it's clear he really researched what happens in tetanus and nailed it. I'm a faker doc in ambulatory care thought there was nothing wrong with me. I'd been puking black. GP already sent me there. I was ghostly pale, and been sick for about 3 years, but fobbed off, and told it was nothing. Eventually whatever I ate came back up 4 weeks. I lost 3 stone. Doc was like well you seem fine. I was like I have a photo of the sick. I keep getting sick. It's been green and yellow and now black. Please help me. He said no I don't want to see them. I puked in the loo, and they said you didn't keep it for me. I was like no you could have given me something to collect it if you wanted it. He prodded my stomach really hard and said I think you're fine go and sit there. I suspect he did some kind of stimulation to my vagus nerve in my stomach either intentionally or by accident because I flopped onto the floor and had a syncope. That or because it was so hard he pressed I may have had a syncope from the pain. He came back while the nurses were monitoring my heart rate which was bradycardic, and I could hear them speaking all while hallucinating I was going towards the light and this was it. He said stop giving her oxygen. There is nothing wrong with her she is fine. Get her out of bed I mustered enough to point at him floppily and say you did this. He poked me. Or, at least, I think I did. I may have hallucinated that too. They never seem to trust me when I'm in pain. Once I had an operation on my breast and it got infected like a year later and instead of treating it assumed my pain was fake because I was screaming for pain relief. I was told to take ibuprofen and sent away. 3 weeks later I had to leave work in pain and go to urgent apt infection. I also have a leg problem. In 6 years it's been stuck and I'm immobile till it pops out. It feels like being stabbed to walk on it. Every doctor starts with oh god that's so bad you've not got help I will help you then the next time it's fine there is nothing wrong x-ray is fine. Oh okay I will just limp everywhere. Please docs, be mindful of those that look like fakers because we can hide a lot of our pain. Just because I will force myself to walk on the leg it doesn't mean it doesn't hurt. I was a faker. In 5th grade I had a teacher who made me very uncomfortable. He would walk up behind me and rub my hair or my shoulders. When I asked a question at his desk he'd put his hand on my back and rub. To this day I don't know if he was creepy or I'm just oversensitive or both, but I didn't like it and didn't feel like I could tell him to stop. I started faking a pain in my left side. It was intermediate school, so we spent the morning with one teacher and the afternoon with another, him, so I'd play sick every day after lunch. Mom took me to doc, who said they found blood in my urine, and I was put into the hospital for tests. I had a blast until day 3, when I had to have both an upper and lower GI. Miraculously I was cured returned to school, but was failing math, science and social studies, so my mom arranged for me to have after school tutorials with the same teacher. I never told anyone the truth. First day teacher is touchy, and I freak out and claim my side is hurting again. Called home and my grandma agreed to pick me up. Teacher is sitting with me on a bench outside waiting for my ride. Hand is around my shoulders and I'm bawling. Next thing I know my grandma drives her book up onto the sidewalk, blasted her horn, jumped out of the car, and told the teacher to get his GD hands off me. I ran to the car and the teacher protested a little bit. My grandma never said, so word just got into the car and drove me home. She never mentioned the situation to anyone, and I never had a fake side attack again. Teacher wouldn't even look at me after that, and I passed 5th grade MS and SS. I also learned to stand up for myself and have never felt like I couldn't speak up when I feel uncomfortable since. Anesthesiologist here. This isn't the biggest case of faking, but often patients who come in for surgery actually want to stay in the hospital as long as possible. I mean, some patients want to be admitted for days after an outpatient surgery. We usually get them out the door without much resistance, but there are some things that would force a hand and keep them overnight. Uncontrolled pain, or residual anesthetic, delayed arousal, or just pain are common reasons. One day I had a quick procedure. I think it was ear tube placement on an adult. These are often done with just local anesthetic, but the patient didn't want any awareness. Just before we roll back to the patient starts asking how many days we'll be in the hospital. I explained that the plan is to send him home after the surgery, and we may skip the recovery room and go right to phase second recovery with is where they are in a chair eating cookies just before they get the boot out the door. The patient seemed very disappointed by this skip to after the surgery. Patient isn't waking up, he is breathing on his own. All vital signs are within his baseline, so I send him to the recovery room to wake up. The entire day of cases go by, and I get a call from the recovery nurse asking what the plan is for the ear tube patient. I'm shocked that the patient is still in PACU almost 7 hours later. I go to check on the patient and they're completely zonked, snoring and not awake at all. I do the basic tests and they're all normal for a sleeping patient. He responds to pain appropriately except for not waking up. I go to check his pupils and his lids won't open. I try again, and he started to clench his eyes shut as tight as he can. Sleeping/sedated patients don't do that. That is a purposeful movement. The more I try, the harder he fights is. I talk to the patient and tell him he has to wake up and go home. No response. Finally, in a raised voice, so he could hear me, I tell the nurse that we might have to keep him overnight for observation if he doesn't wake up. And if the patient doesn't wake up in the next 5 minutes, we will have to send him up to the floor. His hours actually went up a little, probably at the excitement of thinking he won. I then finish it up saying, before you send him up, make sure you put a Farley catheter in so we can monitor their urine. And just to add some spice, I also think he might have a stricture in his urethra, so you might have to get the dilator to stretch it out first. Wouldn't you know it, he didn't even wait the 5 minutes before he woke up completely. Side note, we would never dilate a patient's urethra ourselves. That is something left for urologists to do. I'm an RN, but this story is too crazy for me to not tell it. I was still a student at the time, doing my psych ward rotation clinical. My very first patient was a middle-aged lady, seemingly healthy. As I entered the room to assess her physically and psychologically, I immediately saw that she was in children's pajamas, surrounded by stuffed animals, and was lying in a fetal position, which wasn't out of the ordinary for a psych ward. As soon as I set foot in her room, she requested me to start IVH, intravenous hyperalimentation. This calls for her to have an invasive catheter in her major vessels and rigorous monitoring of her electrolytes and lab values in general. Who would want that, right? Given that she was healthy and able to eat, the healthcare team didn't see why she'd want it or need it. She then asked me to start forth fluids because she couldn't eat anything and she hadn't been eating for over 2 weeks. Next thing you know, during one of my hourly rounds, I looked through her window and saw her stuffing her face with homemade meals from a container that her husband had brought her. As soon as she heard me open the door, she sat on the Tupperware and went back into a fetal position. She denied eating and made the previous requests again. Then, her husband cornered me and threatened me that if this were a different environment, I would catch his hands. Her head physician and psychiatrist then asked me if I could make her sign transfer papers in order to have access to her past medical history and hospitalizations, which she immediately refused. We later found, after the physicians talked to their colleagues from other hospital, that she had been admitted to several units including cardiology and internal medicine, presenting symptoms that didn't make any sense, and with an unknown source. Turns out she had been taking several medications to make her blood pressure and heart rate fluctuate in a very dangerous manner, so basically, she made herself sick. We were the 7th hospital she'd been to in a year. She was then banned from their ERs and hospitals because the only treatment that they wanted to offer her was psychological. Having had enough, the psychiatrist diagnosed her with Munchausen syndrome, where a mental disorder in which a person repeatedly and deliberately acts as if he or she has a physical or mental illness when he or she is not really sick. I was told to tell her that if she didn't adhere to psychological treatment within the following 24 hours, we'd have to start charging her for her hospital room. I live in Canada. It's usually free. She then managed to have her lawyer call our ethical/legal committee, threatened to sue us, and that we were letting her starve to death. She dragged us to court. As a student, I was mortified and obviously lost, and ended up getting banned from our hospital as well. And then we found out that her son had died at 16, after spending most of his time in hospital due to Munchausen by proxy. The mother was a healthcare professional, which is not uncommon among people diagnosed with Munchausen given their knowledge of the field. Obligatory, I'm an RN, but we had a 16-year-old patient smoke an entire e-cig cartridge, which is the equivalent of 50 some packs of cigarettes in one day, and became pretty ill. Poison control was called, and they warned us that for the next 24 hours he would be prone to seizures. He and his family were informed of this, and we kept him inpatient overnight to monitor him. He got quite a bit of attention from his friends, girlfriend, and his doting grandma. His parents were not involved in his life. He liked the attention, and decided he could use a few more days off from school, and so he started faking seizures, though his previous nurses didn't quite realize yet that he was faking them. His grandma was worried sick about him. I came in and took over care for him. I'm particularly sensitive to patients with seizures, as I have a son who has severe, uncontrolled epilepsy that has affected every of his life. When I went into his room at the start of my shift to take vitals, he warned me that his seizures are triggered by the BP cuff. I said I needed his vitals at that time and we will see how he does. Literally as soon as it started inflating, he began flopping around. I'm aware that seizures can present so differently for people, but this seemed off, so I informed the in-house doc that he had had a seizure, but I also suspected it wasn't a real seizure and I would like for him to come up and see him. The doc asked me to check his vitals again, starting with his BP. Again, as soon as the cuff started inflating, he began flopping around during his seizure. The doc starts checking him out mid-seizure by lifting his leg to see what would happen. Typically during a seizure, you don't have control of your body, so your leg would just immediately drop. This patient was able to hold his leg up for doc to keep looking at him, and while he was doing this, he lifted his head off the bed to see what the doc was doing, which also wouldn't be something someone who was typically having a seizure would be able to do. We let him finish his seizure and the doc pulls his grandma out of the room. She's in tears and asks the doc what we can do to help him. He informed her that he's faking his seizures. Grandma was mad and the patient was discharged to home the next day. Psychiatry. I have a lot, but there are a couple that stand out. Points. Saw a woman in the ED who wanted to be admitted because she was thinking of killing herself. What's going on her? I want to hurt herself. Won't say why. Needs to be admitted though for sure at this hospital. Also, her emergency contact is a nurse here. Can you get her for me? She's my daughter. I haven't seen her in a few years because she won't talk to me, but you'll get her for me, right? Also, in order to make you think I'm crazy enough to be admitted, rather than elaborate on my fake plan to kill myself, I'm going to keep saying I want to go home with my daughter, but substitute the word home for Birmingham. Points. Or a man in the ED who wanted to kill himself was just seen at the other hospital 2 hours before where he was discharged because he wasn't serious. He cut his wrists in the most weakest lines I've ever seen. Him: when you admit me, I need a ticket to other city far away. You can do that, right? Like a bus ticket deal? If you don't admit me, I'm going to walk into traffic after this patient admitted already. Me: what brings you here? Him: I'm suicidal, homicidal, and I'm seeing and hearing things other people aren't seeing or hearing. This is an echo of the exact question every psychiatrist uses. Me: okay, let's break this down. He then proceeds. He wants to hurt himself. No plan at all. Is seeing his dead grandmother who speaks to him and is standing there all the time. Totally unconvincing. Me: and the homicidal thoughts? Him: I actually don't know what homicidal means. EMT. I was part of the trauma response team at a level 1 trauma center/emergency department. Was paged overhead for an incoming pediatric patient as a code blue by helicopter. The flight medics were giving us the story as they brought the 15-year-old Gerald into the trauma bay. Her mother heard a loud bang in her bedroom, ran to check on her, and found her laying on the floor saying she was unable to move her arms and legs. Throughout the trauma assessment the girl continued to say she couldn't move anything. Just before we were about to take her down the hall for a head and neck cord scan, the nurse explained to her that she needed to put a Foley catheter in, since she wasn't going to be able to control her bladder. The girl started adamantly opposing the idea, even though the nurse kept reassuring her she wouldn't be able to feel a thing. Just as the nurse starting inserting the catheter, the girl starts flailing and grabs the nurse's arm. Turns out she'd gotten into an argument with her mom just before the incident and wanted to get back at her. The girl ended up being charged criminally for the incident and ordered to pay for the roughly $30,000 helicopter ride and trauma assessment. To this day I still regularly think about what this girl's thought process was as things kept escalating. I can't even imagine being carried towards a running helicopter and thinking, this is getting serious, should I maybe tell them I'm faking this? Nor let's see where this goes. Not a doctor but similar. I was a volunteer ski patrol. Almost everyone else was people pursuing medical careers. I was a ski looking for ski days. We get 2 calls at the same time. One is for a bad cut and another for a back injury in the terrain park. Our best crews respond to each, and I reposition to the top of the hill with a toboggan just in case we get another call. All the while I'm panicking hoping we don't get anything else. Next thing I hear is the radio crackle with another call. A younger snowboarder hurt herself on the Bunny Hill Fac. Okay, here I go point. When I arrive it's a 14-year-old girl who fell and is complaining of back pain and numbness in her legs. Fac again. Backup? Nope. All busy on other calls. Okay. Get Lifty to hold her head/neck and do a quick assessment. Don't find anything. Still says she can't really feel her legs. Okay. Other hill staff, I teach how to backboard her. We get a good roll and then I get her secured to the board and in the toboggan. Now, we don't have any snowmobiles available to get us and our medic shack is uphill. So I cart her as uphill to the medic booth. Get there I'm drenched and exhausted. She then sees that we have 2 major cases going on. The cut was very deep and needs stitches as soon as possible. The other guy backboarded also has a head injury. Suddenly she's feeling better. Maybe she was just tired and didn't want to tell her mom she was done yet. Sorry. Too late. I can't take you off now. Only a doctor can clear you. Ambulance is on its way. Little girl. TLDR girl faked a back injury to get out of snowboarding. Not related about faking, but my doctors thought I'm faking it. I was weak and sleepy all the time for 3 years. Wanted to ditch school to sleep in. Mood swings. Angry, irritated and just tired. Literally taking one medicine after the other almost every week. After 3 years of telling me I'm doing drama, he finally did a test when after a school dance competition I was so weak I could not leave my bed for 1 week. Turns out I had very low iron levels and was anemic. The doctor prescribed capsules immediately and said this will get me feeling good. I started taking them and within a week was back again to the doctor feeling worse than before with severe stomach pains. He would not believe me and gave me antacids. For 3 months I went to him complaining since he was the only doctor in my area and our family doctor. He gave me new antacids every week and kept saying I was faking my pain to avoid school. My parents supported him. I went into a hospital all by myself in pain. They too gave me antacids and hearing from my family my history thought I want more medicine and didn't believe me. I finally hunted for another physician because now it was 6 months and the pain was so bad I could not walk when it came. She did a few tests and guess what? I was a rare case of reaction to the capsule the old doctor told me to take and was close to organ failure, plus I had severe infection which gave me pain. I spent next 2 years on heavy medicines, struggling to eat. I developed a fear of food due to my pain, lost days in classes in my prime teenage years. A physician here. I was working in Hawaii at the time, worked in 2 hospitals on Oahu 2015. During one of my shifts, I noticed one of my colleagues had a patient with an ankle dislocation that he was going to reduce. Checked out the XR. Yup. Talus dislocation should be a satisfying reduction. The patient was memorable because of the way he looked, sort of a pudgy version of Mr. Clean who had a few too many Krispy Kremes. My colleague fixed the ankle, splintered him up, crutches and discharge. End of story. Or so I thought. Several days later I was working in the other on the leeward/opposite side of the island. Little backwater place mostly represented by locals. Midway through my shift, ankle dislocation appears on the board. I see the same pudgy Mr. Clean my colleague had treated just days ago hobbling across the I talked to the triage nurse who said the patient just twisted it playing basketball. No mention of recent dislocation injury. Just to be sure I'll log into the other's site and check the radiology records. Yep, it's 100% the same guy. I love this immediately. He has never seen me. He had no idea I was working at the other and already know everything. I check the monitoring website for narcotics and indeed, this guy has had 20 plus prescriptions for narcotics in the last year. I print it out and walk in the room. Ankle looks clearly deformed and dislocated. Dude says just landed awkwardly from a layup. Denies any injury to ankle in past. Pain out of proportion. Immediately started asking for pain meds. He doesn't know what I know, so I screw with him a bit. Where were you playing basketball? Ever been to other hospital? What do you do for work? I finally relent when I could tell he was really getting suspicious. I tell him I know you were at the other hospital 3 days ago for the same dislocation. I know you're here to get narcotics. I know you've been doing this all over the islands the last year. I then finally administer the death knell. I tell him, before we kick you the fuck out, you should know that the FBI is watching you and placed you on their suspect list of potential narcotics distributor to minors, while handing him the printed out sheets of the monitoring website with each 20 plus narcotics script notated in detail from multiple physicians in many hospitals. He looked terrified as I turned and left the room. 3 minutes later he's walking out the with papers in hand, having self-relocated his ankle, which has been his game all along. Self-dislocate. Gives recipe for axes after reduction. Sell them on the streets. Repeat. Eyes downtrodden, shoulders slumped, refusing to make any eye contact with staff. To this day one of the most beautiful things I've ever seen on that little island paradise. Obligatory. I'm not a doctor, but I have been /that/patient. For as far back as I can remember, I struggled with mental health things such as anxiety and depression, but I always managed to get by without treatment and just thought it was normal teen/young adult stuff that would eventually go away as I got older. This thought process was perpetuated by my family, none of whom have a mental illness, and who all share the idea that mental illnesses are made up by weak-minded, lazy people who are either seeking attention or looking for something to blame their failures on. Well, when I turned 23, my typically manageable depression/anxiety turned into a full-blown crippling mental illness in what may as well have been overnight. Let me just say, I have always been extremely close with my family and we are all very much involved in each other's lives. Even at 23 and 24, 25, 26, I was very much all about my family and cared very much for their input and guidance. I come from a home where I would never hide something as serious as this from my family, and I certainly wouldn't act upon it without first discussing it with them. So, once it became apparent that my depression was here to royally fuck me up, I began expressing my problems and feelings to my family. I was met with the expected pushback. Because I had always dealt with these things in the past, and because depression isn't even real anyway, no one took me seriously. I was getting the ever so helpful drink some water, go for a walk, just stay busy, just talk to me about what is bothering you responses to daily panic attacks, insomnia, a sudden issue with attendance at work, poor hygiene, suicidal ideation, etc. Finally, one day, I had enough and had the bright idea to fake faint. So to the floor I fall. Family drove me to the hospital. Told the doctors about how I suddenly fainted out of nowhere, blah blah blah. Help her doc, help her. Now, I'm a shit actor, but I was never one to fake sick in the past, not even to get out of school, so my family really did believe I had fainted, and had no reason to believe otherwise. The doctor and nurses, however, saw right through me, and I knew it. I had no outward signs one might exhibit during a fainting spell, and none of my tests indicated I had an issue. Never mind an issue that would cause me to faint. Finally, nurse says they are going to have to do something that requires me having to potentially expose my breasts, so everyone leaves my room. Nurses were going through the motions, what champs, and treating me as if I had fainted, and were basically going through the motions to amuse me. But the second my family cleared the room, I broke down and told the nurse what was up. I told her I had been experiencing worsening depression and anxiety symptoms the past month, and that no one took me seriously and would not support my seeking help for these conditions that were all in my head. And if I dared do anything other than shove this sheet under a rug and pretend it isn't there, I would ruin all their lives and forever be the ungrateful daughter who was given everything by her parents, only to turn around and repay them by daring to develop a mental illness. Nurse was such a sweetie and watched me ugly cry and listened to my word vomit and nodded her head knowingly and let me just get it out. She promptly got me set up with psych and even told my family that I was experiencing a physical response to my depression, hoping that the fake physical symptom would validate my mental illness and force them to view it as something worth paying attention to and treating. Luckily, that worked. I'm still struggling to find the correct balance of medications, but I have the support of a family who understands what is going on, is actively involved in my journey toward mental wellness, and no longer internalizes my feelings/emotions/symptoms/behaviors. TLDR. Fake symptom tricks my family into believing in fake disease, so I could get real treatment. I'm not a doctor, but I have been accused of faking it. Please. For the love of God, do not throw around accusations like that lightly. Please. Especially if you are a doctor. I first started getting sick when I was 16. I was active, healthy, in good shape, exercised regularly, ate a healthy diet, yet I started gaining weight very disproportionately. The bigger I got, the more pain I was in, and the more often I'd catch colds, the flu, etc., which would last forever. There were weeks, even months, where I was so sick and in so much pain I couldn't get out of bed. My whole body hurt all the time, and it kept getting worse. The head of endocrinology at Walter Reed Army Medical Center told me, to my face, to go home and stop eating ho-hos. I came to him in agony, desperately hoping for help. Instead I got contemptuous insults. By 19 I was in utter misery. I couldn't work. A company I had started at age 14 and worked so hard on had fallen apart. I had a size 6 waist, my ribs and collarbone looked absolutely emaciated. Yet I had size 26 arms and size 28 thighs. I still don't understand how anyone calling themselves a doctor could possibly think weight gain that disproportionate could ever be normal. Finally, at long last, after 3 years of agony, dismissal, and accusations, a doctor actually bothered to listen to me. To open his eyes and just look at what had happened to my body. Turned out I was born with a very rare genetic disease that mutates both fat cells and the nervous system, causes disproportionate weight gain and intense nerve pain, and suppresses the immune system. I was born with it, did nothing to cause it. Diagnosis was confirmed through multiple tissue samples. I wasn't faking it. It has absolutely ruined my life. Yet despite a confirmed diagnosis from the National Institutes of Health, despite actual tissue samples I can show that demonstrate my screwed up nervous system and uniquely mutated fat cells, guess what? I still get accused of faking it. It hurts. It sucks. It delays care for countless people. It makes the road to accurate diagnosis longer, harder, and more dangerous than it should be. I was exceedingly lucky that my diagnosis only took 3 years. Most people I know with this disease struggled for a decade or more before they got answers and treatment and actual human compassion. Munchausen's, or as it's properly known, factitious disorder, is exceedingly rare. Exceedingly. It's also not quite the gotcha people seem to think it is. Why? Because if someone is faking an illness, if someone truly has factitious disorder, that means they have a very serious mental illness. That still counts as illness. They are still deserving of medical care. Contempt has never cured anyone of anything. Please, don't throw around accusations of faking it lightly. It does real harm to real people like me. People with rare diseases, people with chronic illnesses, people with invisible disabilities. It delays diagnosis, causes additional unnecessary suffering, and can even be deadly. Stop kicking people who are already down. Let's stop focusing so much on fakers and instead focus on treating other human beings with a little more kindness and compassion. Honestly, I think focusing on fakers is, in a weird way, caused by our own unwillingness to honestly face our own fragile mortality. After all, if most people are faking, that means illness and disability aren't as likely as it seems, leaving us with better odds of staying healthy, giving us a better feeling of control over our own futures. That's bullshit point, I know. No one likes to consciously realize that they too could end up sick or disabled. It's so much more subconsciously comforting to instead think most people with seemingly invisible or inexplicable illnesses are instead fakers. It makes us feel a little better, maintaining that illusion of control, that it'll never happen to us. But guess what? Any one of us could end up disabled tomorrow. Any one of us could be diagnosed with a disabling illness at any point in our lives. It's kinder to face that fact than to hurt others with our own delusions of control. TLDR. Please stop throwing around accusations of faking it, because for every one actual faker, it's causing real serious damage to countless legitimately sick people in desperate need of care and compassion. Furthermore, actual cases of Munchausens are ridiculously rare. Instead of focusing on fakers, realize seeing disabilities as fake is most likely a subconscious attempt to deny the fragility of your own health and lack of control over your future mortality. Thanks for coming to my TED Talk. Doc here. I know a lot of stories here and personally talk about people faking seizures for either attention or medication, but there is one person that I have taken care of a few times where I'm still not sure of his motives. He's a 30-something-year-old male with a significant psychiatric past medical history that presents a few times a year with seizures. He is well known to our emergency department and pre-hospital staff. However, what separates him is he is so committed to having a seizure that he will not break character under any circumstances unless he is either actually getting medication or thinks he is. In the past I have instructed certain nurses to go grab Ativan, a common abortive seizure medication, and when we administer it to him, we actually just give a saline flush. Of course his seizure immediately stops, which technically even if we gave him the correct medication would not stop the seizure immediately as it takes a few minutes. Of course when we do this soon after he realizes he did not get the medication and continue seizing. My most impressive encounter with this person is he was so committed he actually caused himself to go into something called rhabdomyolysis, where it causes his muscles to actually break down. I have also intubated him for status epilepticus in the past. Unfortunately, to this day I'm still not sure exactly what his motive is, but I'm always genuinely scared when I see his name come up on the trackboard. And of course to those wondering, yes, he has been admitted numerous times with countless MRIs and EGs, all being normal. Not me but a dermatologist in my family. A mom came in with her 5-year-old son and newborn baby. The older son had bizarre red and slightly puffy spots all over his body. Mother was distraught because she thought the kid had some rare sci-fi type disease, but the doctor thought better. He asked the mom to leave for a moment to have a private word with her son alone and the nurse. Turns out the kid had a toy with a vacuum suction cup on it. One day when experimenting with it, he found that pulling a suction on his arm and leaving it a while would give a weird looking mark, and when his parents saw it later they got worried and kept asking to check on it periodically. The kid felt ignored since his baby sibling was born and he liked finally having more attention from his parents. So instead of telling them what it was from, he thought he could get more attention by doubling down and faking a sickness. Over the next couple days he added a few more vacuum spots, big circular hickeys basically, growing out from where the first one was, and his parents freaked out. It got to the point where they wanted him to see a doctor and he wanted to tell the truth, but was too afraid of getting in trouble for lying. When his mom left the room the whole story came out immediately. The doctor told his mother and she started crying, and they had a warm fuzzy reunion, and I'm guessing a talk about how they still love him, and the baby wouldn't change that. TL. Dr. Child A failed the baseline test so bad he was either faking or has a horrible concussion. Child B faked a stomach bug, and child C got himself home without doing anything, and the counselors, myself and co, found out about halfway through. Not a doctor, but a camp counselor. During a specific session of an overpass camp I worked at last summer, we had a few kids who, although they were not first years, did not want to be there. We expected the session to be bland, and weren't expecting anything of what happened. Day 3 into the session, child A falls, conveniently when no one was watching, and asked to go to the nurse. We sent him as he was complaining of a severe headache, and he stayed there past dinner. After dinner I saw the nurse, and she said he seemed to have concussion symptoms when he spoke about his pain, but when testing she felt like he was trying to act concussed. He stays the night, and then child B starts to feel ill. He stays the night in our cabin. Day 4 comes along, and child A gets sent to hospital for a professional exam. Child B stays at the nurse's office all day, complaining of stomach problems and a headache. I checked in with the nurse that afternoon, and the doctor said, to only me and the nurse, that he failed the baseline test so bad he was either purposely faking, or he had a major concussion, and he surely was not having severe symptoms. That night, we get a very interesting call from his mother. To summarize, children A, B, and C comes into story later, were all friends, and did not want to be at camp. The parents suspected they planned to leave camp halfway through, per texts they read from their kids' phones, but neglected to tell us, or any higher up in the camp. Due to the symptoms, we had no choice but to send child A home. Neither kid had any symptoms when distracted, so we knew by this point they were all faking. Day 5 comes, and child B has gone to the nurse without telling either counselors. We knew he was trying to go home at this point, and so we immediately went to the nurse, and that is where we found him. He would not take meds, and refused to cooperate. His parents came that day, and took him home. Alas, child C is still here. All he is saying is I'm going to leave on Monday. We had no clue how. I swear to God, he sent no letters or anything to his parents. Monday comes, and after he went off on other camp things when neither I or my co-counselor saw him, he packed his stuff and his mom picked him up. No one told us. So we scrambled to find out what happened, only to find that out by the nurse. Sorry for the novel. I found out that a while after we split up my ex went to prison. During his time in there he had a really rotten infected tooth, but it took an abscess bursting pus out of his neck through the external skin before the prison staff would let him see the prison dentist. Prison dentist pulled most of the tooth, but left part of it in the jaw. Ex kept complaining to the prison guards as the infection/abscess just kept getting bigger, and they wouldn't let him see a doctor. Infection burst out of his neck again, and he ended up in hospital with a drain in his neck. The hospital x-rayed his jaw, saw the bit of left behind tooth and removed it. A specialist also noticed that the infection had destroyed the bone in his jaw, so he would need a bone graft from his hip. The surgery to his jaw couldn't happen straight away as apparently the jaw was still actively decaying, and they would need to wait X months for that to stop. X months came and went without him being allowed further treatment. Eventually, 2 years later, the surgeon contacted the prison service wanting to know why this patient had not been brought for treatment. So the prison had to allow treatment to go ahead. I think it was so caring and professional of that surgeon to chase up a patient's treatment, no matter who they are or what they have done. The NHS staff are angels. Oncology nurse here, not a doctor. Bit of a long and weird one. We had a patient who had come in to get induction chemotherapy. Very first thing that was off was that this woman would not put her phone down. Attending is rounding, nurses are passing her meds. Hell, even when the PICC team came to place her line, she wanted to be on her phone. Said she had to talk to her babysitter and other stuff regarding her kids. Well, one evening as I get on for the night, I walk in, and this woman is on her phone as per usual, but out of the corner of my eye I can see she is clearly watching porn. She gets very offended, and my glance, and tells me to mind my own business. When I mention this to the other nurses, they sure enough notice it too over the next several days. So another thing, this woman complained of horrible back pain, and said she could not stand or move, and on top of that, she was having constant liquid diarrhea. We suspected C. diff and wanted a clean catch. Well, She refuses to stand or get out of bed, just wants to stay on her phone and watch porn, so she opts to continuously go on the bedpan, which she has no problem lifting her hips to do, rolling side to side, cleaning herself, sitting up, and literally handing it to us. Can't get a sample cause it's constantly filled with urine too. She then offhanded mentions that whenever she has apple juice, she has really bad diarrhea, and despite this, all she had been drinking was apple juice. We cut her off and magically the diarrhea went away, much to her disgruntlement as she kept asking different people for more apple juice, but we were all savvy to it at this point. Ultimately do not know what the hell was going on there. She had a very complicated background and medical history, and while I know psych had gotten involved once or twice, it never amounted to anything. She ended up not being compliant with care for her PICC line, wouldn't let us change the dressing or anything, got eclampsia, and then passed away. I have one that I feel relates. I'm not a doc, but was the patient. An EMT seemed to think I was faking. Just a few months ago around midday on a Saturday, the whole upper part of my torso felt like it was in a vice grip. The pain in my chest, mainly the center, hurt straight through to my back, and also hurt at the top of my stomach just under my breasts in the center. Kind of where my gallbladder used to be. It had been removed 10 years prior. The pain was excruciating. I honestly cannot think of anything else that bad, and I have given birth without epidural or pain med. I've also broken my neck and shattered my right clavicle in an accident. Those pains paled in comparison. It came on suddenly, and I thought I was dying. At one point even prayed to die. I was in so much pain I couldn't think rationally. After about 3 to 5 minutes of the pain not fading, my 16 years old called 911. When the ambulance arrived, I was doing my best to answer the questions, but the pain was making thinking or speaking difficult. The female EMT rode in the back. I'm female if that matters. She had me hooked up to a monitor and said that I wasn't having a heart attack. Thank goodness, cause that was my thought. She then started to get annoyed by my labored breathing, telling me she wasn't giving me pain med, which I didn't even ask for, but honestly would telling them at that point, so I should calm down. All she could do was take me to the hospital, and putting on a show was not going to get me pain meds or help be seen any faster, and I likely would be sent home. She also said that I could have just driven to the hospital. She was so rude and hateful and bluntly insinuating that I was faking. I was in too much agony to dissuade her. In the ER, I'm taken straight back due to other chronic health issues I have. After the CAT scan with contrast and blood work, they realize that my appendix was about to rupture, and the surgeon was surprised that it hadn't yet, since I hadn't eaten. Yet that day they did the surgery in the next hour. The doc explained that sometimes the appendix makes you have deferred or referred pain. Can't remember which one, so even though I was hurting high up in the middle of my torso instead of the lower right quadrant, it was still appendicitis. He was right, the pain was gone. I know all fake stuff for meds, and I also know that a lot of ambulance calls aren't real emergencies, so I get a little doubt and being cautious. But I genuinely thought I might be dying when my daughter called 911. Thankfully the hospital took me more seriously than the EMT. Not a doctor, but with hindsight, they probably thought I was faking it. Allergy many years ago, semester, sat up playing PC games all night long. Around 0300 I start feeling a bit dizzy. Nothing strange for tiredness. 0400 the world starts spinning. 0430 I realize I shouldn't correct my head once every 5 seconds from the spin. Rise up and it gets twice as bad. Stumble into bathroom and brush teeth for a couple of seconds. Barely get all my clothes off, and as I'm jumping onto my bed everything black spot. I black out, I regain consciousness, and get under the duvet. I instantly FSLL asleep. Or did I black out into a sleep? Wake up at 11:30, sheet driving lesson at 11:50, quick shower and off to it 40 minutes long. As we are driving back to the driving school I start to lose focus. Manage to get back, go home, world spins again. Vomit up everything, literally, empty stomach and still getting vomiting reflexes. Can't even keep water down. Blackout in the bathroom. The moment I regain consciousness I get on the phone and dial 112. Explain the other night and the now. State I can't get into hospital on my own. Point what the medical staff sees. Ambulance arrives. Muscly big man guides me down the stairwell. The entire time the world spins, falling to the left and my body/mind adjusting it to the right, leading to some wonky fake looking walking. Sit backwards in ambulance with a vomit bag. Motion sickness kicks in as well. Great. Vomit reflexes the entire way to the hospital into the bag, but there is nothing left to vomit. They pull up a wheelchair in the hospital and drive me to a room. I lie down for 20 minutes. Nurse comes and do standard tests, but there is nothing wrong with me. Wants to put a drip needle in my arm and explains it will probably hurt a lot. I immediately accept this, and she reluctantly puts the needle in my arm. Realize ambulance personnel laughed. Realize nurse thought it was all fake. Doctor comes 40 minutes after nurse. The world has stopped spinning. After laying in the dark, I'm back to normal. Doctor does lots of tests, but there is nothing wrong with me. So far fake looking walking and vomiting. Forced into a wheelchair for shame. Nurse reluctantly putting drip needle in my arm. Tested me. Luckily he had encountered the same thing before, called virus on one or both balance nerves, which can occur through contamination during a root canal dentist job. I had one the day before. Gets real bad real fast when only one balance nerve is affected. Basically it shuts down, the other one gets overworked, and the mind goes oh no. We are falling to side with balance sense off. No known cure or method of easing it. Wears off after 3 to 5 weeks. When it spins I need to lie down. First and second week I can't be out of bed for more than 2 hours in a row and need sleep every 4 hours. Up to 8 hours week 3, 12 hours week 4. Back to normal week 5. But the shame stays eternal. At least I got another 6 weeks paid leave from work. Also this reoccurred 3 months after, but since I knew what it was, I'd doing my residency in OB and there was one lady who came saying that she was 25 weeks pregnant and said that she had been bleeding and leaking from her vagina and had really bad cramps. However, when she first presented, her effect was calm and she didn't act like how a lot of the pregnant ladies I've encountered who came to the hospital for the same complaints. But everybody deals with pain differently, so I didn't think much of it. From a quick assessment, there was no blood on her underwear or in her vagina since she came to the hospital. The baby was hard to find with the monitors, so I did a quick sono while we waited for the actual tech to come. I couldn't find anything that indicated a baby, and at that point the lady wouldn't even look at the screen, as if she wasn't worried for the well-being of the baby. I swear I saw her rolling her eyes at me at some point when I kept moving the monitor to look for the baby. After a proper stat ultrasound and some lab work, turns out she wasn't pregnant. When my attending came by, pissed, and told her the results of the ultrasound, the lady admitted to not being pregnant and that she just wanted to go to the hospital cause she wanted to get out of the detention center facility she was being held at. She then got pissed that we were letting her go back, but she got all smug after a couple of minutes cause she basically accomplished what she wanted, even if it was just for like an hour. It was annoying, because at the same time, the room next door had a patient who was complete and was about to deliver, but I had to attend to this lady first, because of the chance of an emergency of her bleeding out or delivering the baby prematurely. I guess they're going to have to start doing a pregnancy test before sending ladies over from detention center facilities. TLDR, lady fakes being pregnant to get out of a detention center. FACILITY*EDIT, spelling. A little late to the party, but a while back I had this guy come in, and for some strange reason he was wearing a suit, irrelevant to the story, but just interesting to me. So I walked in the room, took a look at his chart, and it said frequent urination. So I asked him how many times a day are you urinating? He paused for a solid 10 seconds, and then he kind of hesitatingly said 11. At that point I was slightly suspicious, just based on the way he answered, and because 11 times is a lot per day. So I look at him and tell him you're peeing 11 times a day. Then you may have something wrong with your prostate. So, what we need to do is a prostate exam. Right when I said that I could immediately tell he had no idea what he had gotten himself into. He looked at me and just sadly said okay. So I put my gloves on and get him to lean his elbows on the table for the exam. I stuck my hand in, and he suddenly lets out a loud "oh" sound. Unsurprisingly, his prostate was fine, but if that wasn't funny enough, not too much later, when I pulled my hand out he yelled "I'm sorry," because he thought he had shit himself. At this point I was at the end of my shift, so I sent a nurse to give the guy a blood test, which also turned out to be okay, and I went home. I came back the next day and the nurse told me that not only did the patient pass out, but when he woke up he told the nurse that he sometimes gets nervous on airplanes, which, if you didn't know, is a common thing people say in order to get a Xanax prescription. So basically, this guy came in, waited hours to be seen, got a hand up his ass, and passed out during a blood test in order to unsuccessful get a Xanax subscription. Don't be that guy. I just realized I have a lot of faking it experience in my 10-year practice as a doctor. It's fun reminiscing about it. Not in my hospital, but a hospital near me where I know a lot of the doctors that go there. But there's this one lady who is a little bit on the big side, kept saying that she's in labor and that it hurts like hell and everything. She never had prenatal checkup at that hospital and she came in very late at night. It's a government hospital, so they don't really have state-of-the-art equipments and very understaffed. So long story short, the doctor decided to do a cesarean delivery and found out that she's not pregnant, but she still kept on denying the fact that she's not until they saw her non-pregnant uterus. Apparently she faked being pregnant because her boyfriend was leaving her. After he found out that she faked her pregnancy he was gone. It became a scandal through the whole medical community because the doctor operated on her without proof that she's actually pregnant. Another one was when I was stationed at the when a van full of people came in rushing a 20-something girl who fainted after her ex-boyfriend proposed to her. Apparently they broke up and she met another guy, but without the girl's knowledge, the ex-boyfriend talked to all of her relatives. They didn't know they broke up and said he was going to propose to her, so they all agreed and surprised her. She came into the still faking unconsciousness, so I came to her, poked her eyelids, and you know the reflex you get when you poke an eyelid when you're fake sleeping. That's how I knew she was faking it. I told her I know she was faking it and I'm just gonna leave and tend to other patients who really needs my help. After a few minutes, she faked waking up and told everybody that she's feeling better and left. Another one not really faking it, but sorta kind of still was. So this guy came in for a checkup. He was complaining that his head gets hot when under the sun. In our country, guys are required to go civilian military training once a week. I'm a girl, so I don't really know about the ins and outs of it. But they have to practice under the sun at least once a week. So this guy who is openly gay told me that his head gets hot when under the sun. I asked him, does it hurt? No, it just gets hot. I told him that under the circumstances, that is a normal reaction to heat. Apparently, he just wants a letter from me stating that he shouldn't be doing civilian military practice and just want to be stationed at the air-conditioned office. I refused, and he got mad. I work in ophthalmology. A 16-year-old girl came in with severe pain with her left eye. Her skin was an unusual pink color around her left orbit. She reported getting a whitish discharge that she saved to show me in a rolled up tissue. Initially on first glance it looked like an allergic reaction to the orbital skin. However, on closer inspection under the microscope you could see things. Strangely uniform pink skin was in fact painted over with some makeup. So I proceeded to get a cotton bud damp with saline solution and gently rub it on the skin around the eye, and lo and behold, the pink makeup started to come loose and stain the cotton bud end. The eye itself both internally and externally looked completely healthy, as it should for a 16-year-old. Her mum was so concerned, and you tell she'd definitely been wrapped in cotton wool all her life. Pardon the pun. I had to gently explain to her confused / concerned / slightly angry mother that her symptoms were in fact fake and made up. This was around school exam time and the girl had been off for a week already with this mysterious illness. In truth, I think she was just struggling with her education and saw this as a potential way out of it when really she just likely needed someone-on-one tutoring and extra retention. Explaining all this to her mother in a separate room made me feel more like a counselor and less like an ophthalmologist. I'm not a doctor, I'm emergency ambulance crew in the UK. I have two quite good stories. The first is a guy who was seizing on the underground. He wasn't doing it right, so we were suspicious right off the bat. He was shaking and had his eyes closed, but he wasn't falling off the seat or hitting his head on the tiles. Just shaking one side, etc. Whatever, we think pseudo seizure, which present differently. We carry him up 2 flights of stairs. When we get him into the ambulance, I look through his jacket pocket to see if there's anything with his name on. I find his passport. As soon as I take it out to open it, he sits up on the trolley bed and shouts at me to put it back. Fully coherent and swearing at me like I've shot his mother. We tried to get him to get off the ambulance, but he went back to closing his eyes and shaking, so we took him into hospital but didn't treat. The second story is about an 18-year-old male. He told us he had hit his head on the bathroom sink, fell and tried to get up, but had no power in his legs anymore, and fell back down. Says he has central neck pain and no sensation in his left foot. We assess and he fools us 100%. Flinching when I touch his spine but nowhere else. No reaction when we touch his foot with a pen, etc. We immobilized him and had to get extra crew out to carry him down the stairs of his flat. He ended up with 6 paramedics off the road to attend to him and a 20 minutes blue light drive to a major trauma center. When we got there and they x-rayed him and checked his records, he was known to do it frequently. Nothing's ever found to be wrong with him. We were stunned. For me it was the other way around. I was about 7 or 8 and we were at some famous waterfalls in West Virginia. They had wooden railings which me, the dumb kid I am, was sliding my arms along the railings. I had a semi-thin jacket on but it still happened. I felt a quick shock in my arm and immediately stopped. I lifted up the sleeve and there was a huge red bump on my arm. When we got back to my home state I showed my mom. She took me to the doctor the next day. The doctor pressed on the bump for a bit and it didn't hurt, but I said it did. I pulled this act for a good bit until something was done about it. Over time, it did start to hurt, which worried me for a bit. They did an x-ray on it and there were 3 things in my arm. The size was unknown. About a week or 2 go by and I'm getting ready for surgery. They gave me laughing/sleeping gas for me to sleep. I wake up and there was a bandage on my arm. My mom says what was in my arm and where it was. It turns out that there were 3 pieces of wood about 0.5 x 0.25 x 0.25 inch. 3 of them. The pieces of wood were directly resting on my nerve. Underneath the bandage there was a hole in my arm that was about ½ an inch in diameter. For about a month, every night I had to remove the old bandage, clean it out, put on a new bandage, and secure it. Lord damn I happy I overreacted. I may upload the scar if this gets enough attention. Intern year I was taking care of a patient who is usually admitted to our hospital for a few days every month or so for a wide variety of problems. This time was in the hospital for uncontrollable seizures. Every day in the hospital she would had several short-lived seizures, and each one was never when she was in the room alone, but rather only when it could be witnessed, only while a nurse or doctor was around. New attending comes on service and hears a spiel about the patient outside the room from the med student. Before we go in, he walks into the room and patient starts having seizure-like activity. He pulls out an ammonia capsule from his white coat pocket, approaches her, then cups his hands to cover her nose and mouth loosely and breaks open the ammonia capsule. She immediately stops seizing and pushes him away, confirming pseudo-seizure since smelling ammonia wouldn't terminate a true seizure. She had other admissions previously with presumed fake symptoms, but this time the jig was up, objectively. She was discharged later that day, and I go off service. The following week she comes back to Ed for seizures and Ed calls a service to admit. The senior resident on at that time told me he went into her room in the Ed and confronted her, telling her straight up that he knows she is faking her symptoms and under no circumstances is he going to order any labs or imaging to work up any source of her seizure-like activity. He said she looked straight him, furious at the accusation, and then she took a deep breath in and held her breath, never breaking eye contact. He said she slumped over and went into PRS right in front of him. He called a code blue and started CPR. After 3 rounds of ACLS she was resuscitated and intubated, admitted to ICU, recovered and still is a resident clinic patient, frequently admitted for a wide variety of reasons. I made a throwaway for this lol. Not a doctor, but I'm the faker. When I was in middle school, I got mono. It was really bad, and I was out of commission for a month or so. Didn't fake that. When I was getting over it, I fainted due to low blood pressure and hit my head. I'm admitted to the local hospital with a possible concussion, as I'm dizzy, nauseous, and don't have any balance. I pass every concussion test except for the balance one, and they recommend I'm taken to a larger hospital in a nearby city as I'm very clearly ill at this point. While I'm at the hospital, I'm treated for dehydration and other stuff from throwing up, and a slew of other stuff. Anyways, I still have no balance a day or so later, and they are worried. Nothing came up on a brain scan, other than a minor anomaly that doesn't have a medical effect. The doctor diagnoses me with conversion disorder, which is fancy for lots of bodily trauma is bad in the brain gets confused and thinks you are still hurt. Essentially I went through so much shit that my brain took out my balance centers for like a month. I used a walker, went to PT, and was wheeled around in school. I didn't fake my illness. It's a neurological version of faking it that I couldn't help. Funky point TLDR. I was sick for a month, got a concussion, and my brain made me lose balance for a month even though nothing was actually wrong. To the doctors here with patients reporting potentially serious symptoms that you deem frivolous, when you frighten the truth out of them by saying oh, confirming your illness will require such and such a painful test, do you ever worry that you're just frightening away legitimate patients who fear short-term pain more than the long-term consequences of going untreated? This may on its surface seem not to apply to your patient presenting an obvious ink stain as a melanoma type. I ask, though, because my family is riddled with doctors, and they were all rather compassionate types who believed anyone concerned enough to see a doctor, even if that person was misinterpreting, misrepresenting, or even flat out lying about their symptoms, must have something in their lives that was really bothering them, if they've gone to all the trouble of seeing a doctor in the first place. So my family members would always try to coax out of that person what was really going on, to then address that point. Flash forward to several decades later, and with my social science training I'm conducting tests on large sample groups of doctors to determine their diagnosing and prescribing behaviors, and for the first time in my life I encounter haughty, preening, self-obsessed oafs who feel every patient is there to rob that doctor of time better spent on a yacht or a golf course. Real money driven types who probably just as easily sold junk bonds in the ATS, or flipped real estate for a living, rather than treat sick people to whom first do no harm wasn't even a passing thought point. If you're behaving callously towards any patient, don't you worry that you're in the wrong profession? Or does the money and the lack of a conscience keep any doubt from popping up in the first place? Not a doctor, but I do work in a hospital. This is a story about one of my co-workers, a paranoid delusional schizophrenic hypochondriac with delusions of grandeur every single day, and I mean literally every single day, something new is wrong with her. One day, it's a water infection. The next, she's broken her arm. The next, a cold so bad she's sneezing blood. All of it obviously fake, but all of it delivered with a completely straight face, accompanied by 2 coughs. Just 2, exactly the same coughs, every single time every single day for over 20 years now. If anyone else has an injury/illness, she will have it the next day. Earwax build up. Infectious, obviously. Broken finger, yeah, those spread like wildfire. And I mean, she carries on with her job, doing things that she couldn't do if anything she said was true. She can easily do her job, even with a broken finger. I want to add that she is also obscenely obnoxious and often breaks basic health and safety rules. She walks about without socks, has no idea of basic hygiene, and her default volume is catastrophic. Even if she is whispering, it can be heard in the next room. I shall end this off with a final anecdote. She was sent home one day after telling us all that her godparents had died, in amongst geysers of tears, which she can also turn off and on in seconds. So obviously, we called her home to pass on our condolences. Turns out her parents were still alive, and she told them we had sent her home due to an infection. If you're reading this, oh, who am I kidding? I know you barely know how to read. Screw you. Anyway. Not a doctor, but I work in law enforcement. Jailer. Years ago, another officer and I were tasked with taking an inmate to the hospital to have some tests run. He was complaining about chest pains, and when the nurse hooked him up to the EKG, he laid there and just kind of twitched. It seemed to throw off her tests, so she sent him to the hospital out of an abundance of caution. Well, the staff hooked him up, and he just laid there and twitched. Same thing. After a little while, one of the nurses came up to me and said he was faking, and that the hospital was discharging him. On the way out, he claimed that he had to go to the bathroom right then. We were only about 5 minutes or so from the jail, but he said he couldn't wait. I followed him into the bathroom and removed his cuffs. He was still shackled. He pulled his britches down and sat on the toilet. After 2 or 3 minutes he told me he couldn't go because I was in there, and I told him that I wasn't leaving him by himself, and if he couldn't go in front of me, he could definitely wait until we got back to the jail. He got up and pulled his pants up, and I cuffed him, and we went back to the jail point the next day. I was told that on second shift he pulled the same stunt, complained of chest pains, and got sent back to the hospital. Same thing. Our staff hooked him up, said he was faking, and sent him packing. Again, he told the transporting officer that he had to use the bathroom and couldn't wait. Well, this officer let him go in the bathroom by himself. Really, who wants to watch a grown man take a shit? Inmate went in, spent a few minutes, and came out. And the officer took him back to the jail point. When they got back, the supervisor got wise and had him strip searched. Well, someone had put a bag of marijuana and a bag of burglar tobacco in the garage can in that bathroom for him to grab. It was all just a setup to get some contraband. Man, what if it had been a gun or a knife or something, and it was the bathroom in the so set up by an employee? I don't care how uncomfortable it makes you. If you can't watch a dude take a shit, or look at a naked dude without getting weirded out, you probably need to find another job. Just saying. Doctors think everyone is faking it. Even the neurosurgeon who performed my disc replacement told me to take a hot bath for the pain. Of all people who should know how much pain I was in, you'd think it would be this guy. Never mind that I couldn't get in or out of the tub by myself. Thanks, Doc. Point and psychiatrists. My god. Private psychiatrists are great, but community mental health center doctors think everyone is out to get benzos and uppers, and we're all guilty until proven innocent. Every time I see my mediocre psychiatrist, with whom I can barely communicate because she speaks English as a second or third language, I have to be so careful to say the right thing to make sure that she maintains the only medication that has ever helped my panic attacks. I know my history, I know everything I've tried and everything I've taken, and I know what's not available at the lousy mental health center, so for now she's going to have to keep the Klonopin going. Just a few weeks ago, I had a GP throw a fit because I didn't like the referral he gave me. I realize Medicaid is a huge hassle and pays you crap, in your words, but 80% of your check comes from Medicaid or Medicare, and if I'm the one with the seriously F***CKED-UP next OU, and your ignorant rude appointment secretary can KMA, if I don't care for your choice. Sorry, I don't much like being disabled. Either. Don't even get me started on the nurses. Hey, nurses, you are part of the reason I won't go to the hospital for suicidal ideation anymore. You are really that bad. Psych nurses, you suck too. I was doing a month in neuro during my intern year last year, and it was structured in a way where for 2 weeks I would round with the inpatient team, and for 2 weeks I would do clinics. I picked an attending who dealt with movement disorders especially for my clinic portion of the rotation. We had this woman come in on a wheelchair, young, in her 30s, otherwise doing well. She complained of having extreme weakness in her lower limbs for a week. She said she couldn't get out of bed, she could stand, not even long enough to brush her teeth. She had no other complaints. The attending asked me to do a physical, so I go about doing the general physical and then the neurological examination. At one point, he asked me to please assist the patient out of the wheelchair and onto the examination bed, which I did. He then went ahead and started asking her about her life, how things were at home with the husband and the in-laws, while doing a quick exam as well. He was done with the exam, but she was still talking about how things were rough at home, etc. He kept her seated there, listened to her talk, which I felt she really liked, and prescribed her a multivitamin pill. He handed it to her, shook hands with her, and he said, "Thank you for coming in. I'll see you in 2 weeks." Lo and behold, she climbed off the bed herself and walked out of the office, forgetting her wheelchair in the clinic. It took me a second to realize what had happened, but the attending was smiling. He says to me, "Watch her face when she comes back for it." And about a minute later, she comes back into the room for her wheelchair, looking sheepish af, mumbled something and hurried out of the office. I asked him later if she ever showed up for her appointment, but she never did. Obligatory, not a doctor or medical person, but, where I work, has special reserved parking facilities for disabled workers, so that they have easier access to get to work. The system's pretty open to abuse though, because the burden of proof is so low. One woman who started the same time as me, who is the biggest tall tale teller I've ever known, got such a space. She claimed mobility issues due to myalgic encephalomyelitis, ME, also known as chronic fatigue. Despite this, in an icebreaker session during induction, she spoke about how she enjoyed hiking, hill walking and orienteering, and how often she went on holidays. Honestly, everyone but her had a 15-second statement. She took 4 or 5 minutes, so she would often brag about having this space, and about how much she needed it. Like she'd randomly interrupt conversations about non-related stuff to say, "You know, I've got a zone 1 space for me. So if I'm feeling tired, I can just leave. You guys can't do that. You can't just leave. But I can." She'd also regularly talk about her hiking and hill walking points, so naturally a lot of folks complained. To settle it, she was asked to join her manager in a meeting about it. Just a friendly chat. She immediately froze, like went rigid in her office chair. Imagine Robin Williams from Mrs. Doubtfire doing his hot dog impression. Her manager was like, "What's this?" She spoke with clenched teeth from the side of her mouth in the weakest voice she could summon. "It's my condition. I'm having an attack." Naturally the manager called an ambulance. While waiting, she would gradually unfreeze and suddenly refreeze every time people were looking away, then looking back. When the paramedics arrived to take her to hospital, they tried lifting her from the chair, and she was actively pulling away from them, as if glued to the chair. Like she was digging in her heels and she'd lose her rigid pose and brace against the chair, which had wheels, so she was just pushing herself down a room. Then in that pathetic put-on voice would say, "I'm sorry. I can't help it." After 10 minutes of wasting this paramedic's time, this fellow told his colleague, "These aren't the symptoms of me." Faker answered, "What do you mean?" He said, "Well, me doesn't result in rigidity," before adding, "Looks like he'll have to administer morphine to make her go limp." He was kidding, but unbeknownst to him, she was terrified of needles. The second he said that, she suddenly went completely limp and melted out of the chair onto the floor. No conversation with management that day, but every time they tried, "She's have an attack of me, a condition known for your being tired, not going stiff." She still has that space, still brags about how much she needs it, while talking about this physically demanding holidays, and what's more, she's now wrangled a window seat and a rising desk, so she can stand, if she needs to. Not a doctor myself, but my mum does work at out of hours as a receptionist. A few days ago she was telling me about this guy who keeps coming in to ask for epilepsy medication. Everyone in R&D and out of hours has been told not to give him any medicine because he is an addict. He may have been told by someone at one point that he does have epilepsy, but since then he has been tested and he does not. He keeps coming back to reception and asking for medication. My mum phoned the mental health desk and got him to talk to them. After a few minutes he said he was going to R&D to meet someone from the mental health team. A couple of minutes later my mum sees that he's trying to book into R&D, so she says no, you're waiting for the mental health team, and leaves. He then comes back round to out of hours and tries to book in there, saying he has a sore throat. So my mum books him in and says that all doctors have been told not to give him epilepsy medication, so he sits down and waits. He falls off his chair. Couple seconds later my mum asks if he's okay. He gets back up and says yes I feel of my chair. He asks to talk to the mental health team again and says that he's just had a seizure. Eventually he comes up to reception again and tries to book in for more epilepsy medication, and this goes on for ages till he is finally escorted out by security and put on a bus home. Also my mum talked to mental health and they said that he was never supposed to meet them in R&D. He was supposed to go home and make a doctor appointment the next day. Not a doctor, but I was accused of faking. One night I had a migraine and had numbness in my face, Shire symptoms. My friend drove me to emergency. They admitted me to a med bed immediately and ran bloods and urine, then gave me 600 milligrams of ibuprofen and some codeine, unsure of amount. Monitored me for a while then sent me home. The next morning I awoke with searing stomach pain which came in waves and became worse when I laid flat or tried to move around. Heat, Panadol and ibuprofen did nothing. Eating made it much worse. I was incredibly nauseous. After trying to go to class and collapsing on the way back, a different friend drove me to the addition. After realizing I didn't have appendicitis told me I was probably getting my period, gave me more Panadol and ibuprofen, and sent me home. I overheard the doctor telling the nurse that he thought I was drug seeking. The next day I ended up collapsing in class. Ambulance called, hospital trip. This time they suggested I had appendicitis and gave me a large dose of morphine and sent me home with a referral to imaging. I was not able to walk. Day 3 of agonizing pain and no real diagnosis. My friends visited me and told me they've never seen me look this unwell. They dragged me to the imaging clinic and forced me to have the ultrasound. Pressing into my abdomen caused intense pain and I bawled my eyes out in the reception area. The receptionist, bless her soul, told my friends to take me to the big hospital an hour out of our way. The big hospital was amazed that they refused to do further tests, gave me morphine, and realized I was really allergic to it. Booked me for an endoscopy. They eventually diagnosed me with 2/massive/stomach ulcers. Too many NSAIDs screwed my stomach. The people who didn't take my pain seriously, that sheet was debilitating. I'm not a doctor, but wanted a prescription for Xanax. So I go to a clinic, and I go in, and I'm just going to go in for a regular type of checkup, and at the end, I'll ask about Xanax. So I get to the front desk, and they have a "Why are you here" sheet. And I wanna pick something that will get me out really quickly. And I look down, and I see frequent urination. And I was like, perfect, that'll be a super quick visit. It'll just be like, hey, sometimes I pee a lot, and the doctor would be like, me too, crazy right? And I'll be like, I get nervous on airplanes. So I checked off frequent urination, and I sat down in the waiting area and I waited for 3 hours. I finally go back to the observation room and in the observation room there was a male nurse standing there, and he has a Batman sticker on his stethoscope, a Batman necklace and a Batman watch. He was kind of moving around the whole time. He was just like, alright, I'm too blessed to be stressed. Let's do it. What are you allergic to besides work? And then he'd take something and throw it over his shoulder and be like, beats working. And all of his jokes were anti-work, which is not always what you want from a healthcare professional. The doctor comes in the room and the doctor looks at my chart and he says, oh, you're here for frequent urination. How many times a day are you urinating? And I tried to think of a number that would warrant a doctor visit. So I said 11. That was too many times to say. The doctor looked at me and said, you're peeing 11 times a day. Then you may have something wrong with your prostate. So, what we need to do. So I don't know exactly how he phrased it, but the gist of it was, hey, if this visit was to continue, I'm going to stick part of my hand up your ass. And I didn't know what to say. Cause I couldn't be like, no, that's okay. I was lying. It was a lie to get drugs. Like a crime. So what I did was, I pulled down my pants, walked over to the observation table, and I put my hand on the observation table. And by the way, part of me was like, whatever. You ever have those days where you're like, this might as well happen? Adult life is already so goddamn weird. So I'm bent over like this on the table, and the doctor comes up behind me and says, no, not on your hands, your elbows, and he knocks me down like that. And elbows is so much worse. I don't know why. I think it's cause hands has a little remaining dignity to it. You know what I mean? Elbows is sort of like, go stick it in. I'm an American. This is like you're leaning over the edge of a cruise ship and you're like, ah, we are approaching Martinique. He knocked me down to my elbows and then he stuck his hand in. And you know how sometimes you're like, I bet I know what most things feel like, yeah, no? You just think you'll know? I did not know what this was gonna feel like. And this was the actual sound I made. I went, UHM. But I didn't say it like it came from my vocal cords, but it was totally involuntary. It was as if a ghost had been trapped in my belly and finally flew out towards the light. And then, when he pulled his hand out, we had gotten to know each other pretty well, so I'll phrase this as delicately as I can. I didn't not realize that when the doctor pulls his hand out it feels like you're sheeting, cause the only thing to come out of your butt before has been sheet. So, he pulls his hand out, and I thought I was sheeting into his hand. So I yelled, I'm sorry. This is a very routine procedure by the way for most doctors. And so far he's had to deal with and I'm sorry. And he didn't even let me off the hook, you know? He wasn't like, oh don't worry, you didn't cheat into my hand. He just threw his glove away and went hour. And I was about to ask about Xanax, but he was like, alright your prostate's fine, but we still need to do a blood test. So I pulled up my pants and shuffled away, feeling different. And he yells out into the hall, he goes, hey, we are doing a blood test in here. Get in here. Batman dances back in and he's like, alright, we gonna do a blood test. You look different, let's do it. The doctor left the room, so I'm alone with Batman. I just need this blood test to be over. But first I had to tell Batman something. I was like, Batman look, I'm one of those people who, when you take blood from me, sometimes I can faint. And I was in the waiting area for 3 hours and I haven't eaten anything all day, and I'm really worried I'm gonna faint. And Batman said to me, and I'll never forget it, PSHH, you're not gonna faint. So, I stick my arm out, Batman puts the needle in my arm, and I'm immediately on the ground. I wake up, and I'm covered in sweat lying on the observation table. I wake up, I open my eyes and I see Batman's face. He's looking at me and he goes, you gotta go, and I go, can I please talk to the doctor though for a secretary because sometimes I get nervous on airplanes. And Batman said, the doctor's gone, so I got my stuff and I left. The moral of the story is that, if you've been nervous your entire life, you should ask your doctor about Xanax, because if you lie to him, he will stick his finger in your ass. And if you do suffer from frequent urination, keep it to yourself. I went to that clinic 2 years later for a different checkup, and as I was leaving, who do I run into but Batman? And he smiled at me, and he was wearing reading glasses to show that time had passed. I'm a EMT. We handle cases of incarceritis a lot. We went out once to a well-known individual who suffered from chronic incarceritis. Every time handcuffs went on he became gravely ill. He would have chest pain, hyperventilating, shaking, elevated heart rate. Police had found him and caused a flare-up of incarceritis. He had been breaking into a house and shooting up meth all day. He was unable to walk without assistance and chest pain, difficulty breathing. We put him on a monitor and the only vitals was slightly elevated BP, which happens when people get nervous about such things as going to jail, and elevated pulse, one of the many side effects of meth. He went to the hospital, small county not hospital, placing him out of the PD's jurisdiction, meaning a warrant would be as for his arrest, but he wouldn't go that night. Once out of the county his BP improved, chest pain went away, breathing returned to normal. He was feeling so much better that when we got to the ER he told the doctor he did not need treatment, he would go home. Point on the other side, we was dispatched to the county jail for a inmate who was found unresponsive in a holding cell 2 hours after being brought in. He had told the jail he had taken several pills before being arrested, and the jail, being the jail, did not believe him. Well, once we pick him up and get him in the truck, we check to see if he is alert to pain, which he was not. I even went as far as touching his eyeball with my finger, the telltale way, to see if they're faking. No response. The very dramatic and untrained person working intake had told us every panicked he was unstable. But she changed her mind to he was faking and would not be convinced to anything else. because after giving fluids we could get a slight pain response. The man was overdose narc did not work, so it wasn't a opioid. The jail did not ask what type of pills, since they knew he was laying. We took him to the ER, not sure what the outcome was. Not a doctor, but this is an epic faking / milking it story. My coworker started getting sick on Fridays or Mondays. Then he started getting sick on Friday, Monday. If our boss was out of town, he'd reliably get sick on Thursday after lunch and come back to work the following Tuesday morning complaining about his sinuses or something. One day, he just didn't show, and the next, and the next. I live on the beach, and I saw him playing volleyball one afternoon when I got home from work. Weird. A couple weeks went by, then a month. I saw him playing volleyball a few more times in the afternoon. Some other coworkers, girlfriends, friends saw him out and about during the day on work days. Saw him at breakfast or lunch, sometimes with girls or friends. Saw him at the gym. Saw him on walks / skating / biking. We saw him tagged on FB posts from his volleyball group. Meanwhile, our boss told us he was really sick. I brought up the beach volleyball thing several times, including with video and photo footage, and kept getting shut down. Eventually, corporate hours got involved. We work overseas, on an international assignment, so corporate hours was saying, if he was that sick, he had to come home. My manager lied, and said he had been in and out of the office the whole time. He hadn't. I overheard the teleconference, and was blown away. I think my manager, he's gone now, took another job, and my coworker had something funny going on. Anyway, after precisely 6 months out of the office, my coworker shows back up to work. He's fine. I see him at the gym sometimes. Every now and then he takes long weekends. The entire break was fully paid, with benefits. He continued to accrue vacation time, and that in itself was an issue, since he'd accrued something like 500 hours of paid vacation. I guess taking long weekends all the time as sick days really helps you save vacation time. Anyway, maybe he was sick, maybe not, who knows. All I know is he got 6+ months of vacation time fully paid while he gymmed, played beach volleyball, and went on dates / vacations. This will get buried. Also not a doctor. This happened to me. I went to the ER once because I had taken a pregnancy test a few days prior that said I was pregnant. I was also out of town, so I went to an ER I was unfamiliar with. I couldn't have been more than a week pregnant because my period was only a week late. One evening I started bleeding and had severe pain. I decided I needed to go to the ER. I was out of town and scared. When I went to the ER they did a pregnancy test. It came out negative. Then they did a stomach ultrasound and a vaginal one. They didn't see anything, although the doctor did say he saw something blurry or waves moving. I don't faking know, but he said it was probably nothing. Everything came up, that I wasn't pregnant, and I probably was just getting my period. But what really upset me was when the doctors left the room, behind the curtain. I can hear the doctor say the nurses she's probably faking it. She's here with her boyfriend. She's probably just trying to convince him she's pregnant. I could see their feet. They couldn't even bother to walk away and she'd talk. Lol. I was so upset because I was with my boyfriend at the time. He heard this too and looked at me like I was crazy because he believed what they said. I felt insane because I wasn't trying to fake anything. I was concerned, and had it not been for the positive pregnancy test I got that my boyfriend also saw came up positive, I would have never went and assumed it was just my period coming late. I felt so stupid and I was crying. It was a mess. I still wasn't convinced that something wasn't wrong. I didn't want to be pregnant, but I felt something wasn't right. I was still having pain. Not unbearable, but it was a constant dull pain, but no more bleeding. I had only bled that one day I went to the ER. So my period never actually came. A few weeks later I scheduled a appointment with my gyno that I had been seeing since I was 15. I'm now 20 at the time. I explained what happened. They did a simple urine test and it showed I was pregnant. To make sure everything was okay they did an ultrasound. Sure enough they can hear a heartbeat. My doctor said, although not very common, it's normal to feel pain, even a dull aching pain, and to bleed around the time that would have been your period. I always like to think back at this story because here I'm with a teenage son. If you are wondering what magic pregnancy test this was, it was just clear blue pregnancy test. For years I swore by this test because it told me I was pregnant before the doctors could tell. I also learned years later that pregnancy test can vary in sensitivity. So there is a good chance the pregnancy test that the doctors used to check my urine wasn't as sensitive as the home pregnancy test I took. If they had done a blood test, my HCG levels may have shown slightly higher and could possibly confirm a pregnancy, but I wasn't given a blood test. Neurology resident here. We see many forms of "faking it," which we call "functional signs" or "functional overlay." I see functional signs most often when I'm on call covering the emergency department. The patients that come in with weakness, seizure, and strokes are all candidates to have functional overlay. This may seem scary given the severity of these complaints. However, it's pretty obvious when someone is faking it. You pick it up with experience. One night, there was a 43-year-old female presenting to the ED wearing an orange jumpsuit and shackles on her wrists and ankles. Apparently, she had received her sentence and suddenly developed chest pain, left-sided numbness, and weakness. A stroke 1 is called when she arrives, and I race down to assess her. I run through my physical exam, and she doesn't give much effort on the left side. There are 2 quick tests to see if she was faking it. The first is nail bed pressure. This works like a charm for functional weakness and a psychogenic seizure. I grabbed my reflex hammer and anchor it across her left great toe and later her thumb. Each time she pulled away with good strength. Next, to check her left-sided sensory loss, I applied a vibrating tuning fork to the right side and left side of her forehead. The rule of thumb is this should feel the same on both sides for vibrational sensation. She, of course, states she can't feel the left side. I'm confident she did not have a stroke. She goes through the MRI, which is negative, and I'd give her the good news, no stroke. Even if it's obvious that someone is faking it, they can have functional overlay which may be covering up something that's real. For example, someone can have both real and psychogenic seizures. Midwife here. In our hospital, we are having some issues with our emergency department. If they get a patient who's pregnant, they immediately send them up to us on the labor ward. No questions, no examinations, nothing. It's extremely frustrating, but we can't do anything about it. We got a call from R&D saying they were rushing up a patient who was pregnant with triplets and in premature labor, contracting, and they had given her Entonox, gas, and air for the pain as she was screaming. We immediately prep for a potential emergency cesarean while we are waiting for her to come up to us, plus alerting the whole obstetric team, pediatric team, operating team, as well as pulling several midwives from the maternity ward to help. For reference, we don't look after triplet or higher multiple pregnancies in our hospital. They get sent to a large tertiary unit 10 miles away. She comes upstairs on a stretcher with doctors and nurses running along, in case she had started to deliver in the lift or on the way up to us. Proper TV drama action. We take one look at her, and there was a collective groan. No one had really taken a look at the patient in R&D. They had just panicked with the symptoms and information she had presented with. She was 55 years old at least, a little on the large side, with a large back bump that was literally a pillow stuffed in her jumper. She appeared to be either living in poor conditions or homeless. We stand the teams down, many of which have had to leave their patients to help with the emergency, putting them at risk, and then deal with the problem at hand. They'd given her the gas and air, and she wasn't going to let it go anytime soon. We don't have a security department per SE. The porters usually come and help us, or we call the police. Our hospital site is adjacent to a police site. We told her we knew she was faking it. She said we couldn't touch her, blah blah blah. Because she'd come up from R&D, the gas and air was from a cylinder. They are pretty small, so that they are portable, and not meant for long periods of time, just to get the patient's pain under control, or transferred to us. So we had to let her sit up. We told her she would be as sick as a dog if she kept going at the rate she was, but she wouldn't listen. So within 15 minutes she drained the cylinder, and then puked everywhere. As she wasn't a patient of ours, we had no obligation to clean her up, and although we might have, if she had been sorry for the issues she had caused, or even polite, she hadn't. She'd been abusive. When she worked out we weren't going to give her any more pain relief. So we called the police and they escorted her out of the building, covered with her own vomit, and holding her pillow. A personal story, and then a story from work. Point: I was treated as a pain pill seeker because I came in with excruciating pain in my right leg. I couldn't put any pressure on it whatsoever, and every 10 to 15 minutes it would get worse to the point all I could do was scream and cry. To this day my husband says it sounded like I was faking JT, even though I wasn't. Point: they took urine to clearly check for drugs. Which, yes, please be vigilant. But then ordered an ultrasound on my leg. Without any pain medication. The ultrasound lady took one look at me and said there's no way I can do this with her in so much pain. She insisted they give me something before she did it, and I still had a hard time without crying. All I could do was weep into my pillow without looking at anyone. They ended up sending me home with nothing. Couldn't work all that week. Spent the next 5 days and nights up in a chair because laying down flat caused too much pain. Went to a different got diagnosed with cellulitis. After they ran blood tests, it didn't show up as how normal cellulitis does. I had had strep 3 times in the last 6 months, and it traveled to the nerve in my leg and killed it, which is why I was in so much pain. The classic signs of cellulitis didn't even show up until day 3 of my 7-day hospital stay. I walked with a limp for 5 months after, because I couldn't lift my ankle or wiggle my toes. I cried the first time I was able to wiggle my big toe. I still have some numbness in my lower leg, which I didn't realize until I got it to there and doesn't feel it going in. And since I'm diabetic I was extra holy shit, luckily it healed fine. I got the tattoo a few years after the cellulitis, to be clear. Didn't want to risk getting that mess again. Point: work story. I'm a home care social worker. One of my patients ended up having to go to rehab for physical therapy, and they were talking about having her move into a nursing home, which I was on board with because both her and her husband were frankly unable to take care of themselves, and she always had opinions on how things should be managed. One day I get an alert that she is in our hospital with a bizarre delirium. She was talking about how she was a lesbian now and wanted to leave her husband. She wasn't recognizing anyone. She would talk about Jesus visiting her. She had her good friends. Truly bless these people, because they put in a ton of work trying to ensure the best outcomes for her family, convinced that something was wrong. Luckily she had been a patient of mine at that point for a few years. As part of my program we do annual assessments for dementia and depression, and had a thorough history on her. Also would go out whenever she or her husband came home from the hospital, and did monthly check-in phone calls. No prior psychiatric history. Always presented within normal limits and orientation. Never had any hint of what she was trying to present. So I was asked by inpatient team to try to come in to see her and how she would react. She did recognize me and knew my name. When I tried to pinpoint her answers she would turn to her friend who would point to us for her to answer. She would randomly shout inappropriate sexual comments as I was trying to ask her how her daughter was. Tried orientation questions. Asked her about something, but changed the details which she would correct before going off on how she was saved. Never could figure out what her endgame was other than trying to get out of that rehab. Even told her we were concerned enough to be strongly considering having her on inpatient psych, which I knew she was against, because when I first tried to tell her a few years ago she was showing signs of MCI she said she wasn't crazy. She asked why I hated her, because she loved me so deeply. Everything checked out medically. No UT. Causes delirium in older folks for some reason. Notes would indicate that whenever she sensed people outside her room she would yell and carry on with bizarre statements. But that it would stop when she couldn't see anyone. Not a doctor, but my aunt started to notice a small bump form on her eye. She went to the eye doctor and supposedly he said it was a tumor growing behind her eye. She was calling my mom constantly telling her that she was losing vision from her eye. My mom said, "Let's just take you to the ER now." My aunt refused to go to the hospitals in town. So like around 8 PM, we drove 2 hours over the hill to San Diego to a hospital in ER. My aunt says she is completely blind and cannot see from her affected eye. So the ear doctor is checking it out and calls in a specialist. The specialist keeps asking her, "You can't see from your right eye?" "Yes," she says. So another doctor comes in and asks her the same question over and over. That's when the specialist comes in and puts in eye drops, looks in her eye, and is like, "I see the bump you are talking about, but I'm not sure what is causing your blindness. Do you see this light?" "No," she says. "So it is completely blind?" "Yes," she says. After a series of questions, the doctors come in and offer her Ativan. She says no, but then a few minutes later says to me, "I want the Ativan." I go and let them know. They give it to her. Then she starts talking to herself saying, "I feel guilty. I feel guilty." The doctors say that they can refer her to the Shelley Institute, but she's like, "No, doctor, I want to be admitted." They are like, "UHH." After they leave the room, she says to me, "I feel guilty." I ask her why. She whispers, "I'm not blind. I could see." I kinda wanna laugh, but I have to ask, "Oh Shire, you can see now?" Then she says, "I can always see," but they wouldn't listen to me unless I said I was blind. It was already 1 in the morning. As soon as the doctor comes in, he orders another Ativan, and they give it to her, and then in the most weirdest, dramatic fashion she grabbed the doctor's hand and says, "Oh doctor, I can see now, doctor. I can see." The sheet docs have to put up with, and they knew it too. That's why they were offering her Ativan point. Shout out to UCSD. The staff was awesome despite my nutty family member. Not a doctor, but I've witnessed a major faking it case. An old friend was in a bus accident. She was sitting where the other car hit the bus after running a red. She went to the hospital and doctors gave her a full check over and cleared her a week or so later. I'm giving her a ride and she starts seizing in my car. I'd never seen a seizure in person before, so naturally I was freaked out when my friend started convulsing in my passenger seat on the freeway. Pulled over, called 911, got her to the hospital. They ran tests and didn't find anything. She mentioned that a bar from the bus ceiling had hit her in the head, which she forgot to mention to doctors when she was in the accident, and, as a result, they didn't test her head at all. So they have head scans to check for seizure causes and find nothing. They ask her what her pain level is and she says, in the most casually relaxed tone of voice, "Oh, about an 8. I thought the doctors at the hospital were very thorough and professional. But she claimed that these doctors clearly don't know what they are doing, because apparently they didn't check her head when she didn't tell them about being hit there. Yeah. No. Nor did they give her specific tests she wanted. I don't remember the tests, but they wouldn't have helped at all for the specific type of brain injury she was claiming to have. She faked seizures a couple more times after this incident, none of which I actually saw. One time, she had a chiropractor appointment. During the part of the appointment where the chiropractor steps out to let you rest, we heard a thud from the room. We went in to check on her, and she was laid out perfectly on her back. Think yoga corpse pose, a few feet from the table. I've fallen out of bed before, and I have never landed like that. She also claimed that during one of her hospital visits for seizures, she claimed doctors found a blood clot on her brain that was causing the seizures. She claimed they couldn't remove it because the surgery was too risky with approximately a 10% success rate. So she would have this clot for the rest of her life. She would also be texting me and start texting me things like "I feel dizzy" before ghosting me for a while, and then texting me again with "I had another seizure" as she began to notice people weren't giving her attention for them anymore. The seizures got less and less frequent and eventually stopped altogether. It's been years since then, and she seems to have conveniently forgotten any of that happened. Had a patient with chronic pain, fibromyalgia, chronic migraines on narcotics daily at home who was a frequent flyer and demanded I've Benadryl and Dilaudid for her migraines, since that was the only thing that works. Got insanely angry if she was denied it. Also looked like she was almost beginning to withdraw from opioids, on crazy doses at home. PO Norco, can't remember if she just ran out or not. When people come in for that, and that frequently with that attitude, you have to wonder if there is any drug-seeking behavior. I've Benadryl gives you a crazy high, so there's no need for that in that situation over PO, unless they are vomiting. She refused PO and said only fourth works, which made me really question what the fuck was going on. and her frequent admissions were red flags. I felt bad for her though. She was in pain one way or another, even if it wasn't migraines. But who is to say it isn't just migraines causing it? I guess I'll never know. It's something you can't run a test and prove in the hospital. However, I try very hard not to assume someone is faking. That will get you burned one day. Case in point. One lady I saw with migraines and fibromyalgia, both conditions that many doctors will sigh when they see a patient having these, had bad stomach pain in it. Most people could have just assumed it was nothing serious worth doing a court for. It is so hard to examine people chronic pain and rule out acute life-threatening conditions properly, but turned out to be acute appendicitis. She could have died if she was written off, which I'm sure happens. I don't have a story and I haven't faked it, but there seem to be enough doctors here to hopefully help me to understand what kind of seizure I may have had, if I had one at all. Had my wisdom teeth out several years ago. Within 10 minutes of my waking from the anesthetic, my entire body went rigid, as stiff as a board. My legs and arms felt like they were trying to stretch out as far as they possibly could. My fingers and toes curled up into claws, and my jaw clamped shut. My surgeon asked me if I was having a seizure. I made the best no sound as I could. I'd only ever heard of seizures being when someone shakes and loses consciousness. Since I was awake and aware of my surroundings, I didn't believe I was seizing. The whole thing lasted about 45 seconds before it stopped as quick as it had started. Now, when I got home I thought about my surgery and the drugs I'd been given. Before the actual anesthetic, I'd been given an injection of a drug that made me feel extremely woozy. My research revealed that this drug, it starts with an E, that I know for sure, but I can't recall the name, is known for causing seizures as the drug leaves your system. I'm at a loss as to what type of seizure I had, though. I really need to know so the next time, touch wood there isn't, I need an operation I can inform the doctors about my reaction and not be given this drug again. Any ideas? I apparently look to be faking it whenever something medically serious happens to me. Case 1. I have horrible abdominal pain that reoccurs every month or two for about 6 months. 2 hospitals don't believe me, just kept calling it idiopathic. The 4th time it happened, I drive myself to the hospital in so much pain, I don't recollect the drive at all. I'm crying and begging in the waiting room for someone to help me. Once I'm in Tridge, I literally reached for a doctor that was walking by and told him, please, I need help, I think I'm dying. I try to tell them that I'm not drug seeking and I work in healthcare, all of which I'm sure they hear a dozen times a day. 2 older black ladies sitting next to me go to the Tridge nurses and tell them there's something seriously wrong with me and that I need attendance. I live in Baltimore. The wait time for the hospital was 12 hours. When I'm finally taken back, one of my lungs had collapsed, my kidneys were not functioning, and I had a blood infection. I had chronic pancreatitis, which had caused all of this, and no one believed me because I was 23 and not a big drinker. I was in the ICU for 2 weeks and the hospital for 6 weeks. I nearly died because no one believed me and just thought I wanted pain meds. Case 2. I'm pregnant and having horrible abdominal pain, again. Only in my first trimester, so my doctor tells me, oh, a little pain from your uterus stretching is normal. I try to tell them that this is not normal pain. After nearly passing out from walking around an auto show with my SO, he wasn't too concerned and wanted to make sure he was able to hit all the vendors' priorities. I asked him to take me to the hospital. I have a football-sized uterine cyst that has traveled up towards my abdomen due to the increasing growth of my pregnancy. Need to have emergency surgery so that the cyst nor the pregnancy rupture. They cut me open from right under my rib cage to my pubic bone in order to remove this giant cyst. And no one believed my pain. I must look like a drug seeker. My story is the opposite. In the year 2016, out of nowhere I started having a major pain attack in the middle under part of my ribs. It was like somebody was cutting my organs out with a knife. I had kidney stones before, but this was way more painful than that. I went to the ER and the doctors ran many tests, but they couldn't find anything. I started to get these attacks about every few months, and after an echo they found gallstones in my gallbladder, so they suspected I had colic attacks and the logic step was to remove my gallbladder. I had my gallbladder surgically removed in 2016. But after a month the attacks continued. After many tests, and spending many days at the gastroenterologist department in the hospital, they started to get frustrated. Every time when I got back to the ER I got a few morphine shots until the pain went away, and was sometimes discharged from the hospital the same day without any medical research, only standard blood tests, like liver values etc. And one day in 2019, I got an attack for over 10 hours. This was my longest attack. I really wanted to die, because the pain was unbearable. After that the pain went from a few times per month to daily. At the end, the doctors thought I was just overreacting or lying, and they cut me off the morphine. My pain score was a 10, my kidney stones was a 8, and it was stuck for 4 days. I was only administered 2.5 milliliters morphine subcutaneous 3 times over a time period of 4 hours per dosage, and they refused to give me any more, because they were telling me that this was the maximum dosage or I could die. At home I already was used to 6x 10 milligrams oxycodone, and that is way more than the hospital gave me. I screamed my lungs out. I started to panic, and the pain was a traumatic experience even to this day. I called my girlfriend, and she was allowed to stay the entire night. The next day the doctors told me they couldn't do anything else to help me. They said I had to live with the pain and they didn't want to hire my oxycodone dosage from home, so I couldn't get any rest from the pain. The next day I went to my general practitioner, and I got an attack right in front of her. Luckily she took the pain very serious, and I got an morphine shot of 5 milliliters to begin with. My medication was altered to fentanyl patches, 37.5 mcg per 2 days, and 3x 10 mg oxycodone per day. I was finally able to cope with the pain without rushing to the ER. The next day my girlfriend googled for the term skin pain and we came across a site that was written by a doctor from a different hospital a few towns away. The page described something called acne. All the symptoms were exactly the same, and I immediately asked for a appointment. And after 2 months the diagnosis was made. I have acne. After 3 years fighting the doctors to get them to believe me, a weight was lifted off my shoulders. The pain was finally being treated that was supposedly in my head. Now I'm getting shots every 2 weeks directly at the region where it hurts, and I'm slowly getting better. If this treatment is finished I don't have to take morphine anymore and the shots work permanently. I'm happy that I didn't listen to that hospital's advice and kept on searching for an answer to treat my pain. Unfortunately I've lost my job because I've been sick for over 2 years. My relationship took a real toll and I'm furious that the hospital that I put my trust in didn't took me serious at all and didn't even took the time to give me the proper medication to control my pain. And they took out my gallbladder. That not only didn't cure me, but since the nerve was punctured during the surgery it made the acne even worse. I experienced with my own eyes how doctors think they know everything better and the patient is dumb and only follow protocol without thinking about the patient's well-being. They made many mistakes when I was hospitalized, and I saw many doctors in that hospital who didn't look further, and it took my girlfriend one Google search to get the final diagnose. That's why I'm pissed at medical professionals who think they know it all and think you're overreacting when they don't know where the pain is coming from and therefore were not valuable of their time. I'm thinking of filing an official complaint as soon I'm off the painkillers and completely cured. Thankfully I found the real answer to my unbearable pain. Hopefully I get to live a normal life soon. Don't know if I'm the only one or that there are more people who experienced this kind of behavior from doctors. Not a doctor, but it's a story I gotta tell. Gonna be as vague as I can though, because it's somewhat recent, and I don't want someone to recognize me from this. I work at a theater. At one point we had an worker take a tumble down a staircase in the remote part of the building. No camera, no witnesses. First thing they do is call my boss, who then tells them to call 911. Security comes in. Somehow the family finds out without one of us calling them, and I direct the EMTs to where they were once they arrived. 2 days they come in with a neck brace and a cane, the whole 9 yards, hand us a DR's note, and tells us that the doctor wants them to not work for at least 2 weeks. Issue is that the very note they handed us says that they would be completely fine to work that same day. A few raised eyebrows, but no one directly confronts them about this. Another 2 days go by and the GM swings into town. He's in the office, and they notice the worker's sibling peek around the corner, as if they were looking for something/someone. 2 minutes later, guess who pops back up? They get with the GM, and the short version is that they blamed the note inconsistency with a typo, which would mean the doctor got both the day and the month wrong. They somehow never got any release papers, nor did they receive anything that would corroborate the injuries they said they incurred. And finally, when the cane and brace are brought up, they admit that those were not given to them by the hospital, but they had rather received it from a family member who had been in an accident before. This includes a device they had attached to their side which they said was to monitor the health of their limbs. Their story of what happened didn't really seem to match up either, and eventually it was explained to them that it sounded like they had a medical issue that flared up and made them faint, which caused their injury, not anything on our part, which would make them ineligible for workers' comp. The next day, somehow the other sibling also has a fainting spell in the bathroom, where once again there were no witnesses or cameras, as it is a bathroom. Not really helping them claim it wasn't a medical thing. Guess who shows up that time too? The worker who fell, no brace and no cane. Their mom was there too, and asked us if we knew they had passed out, and we all went, no, obviously not, and that is where the story ends for now. This is still kinda ongoing, but I'm pretty sure it's mostly done at this point. I was shoveling chicken biryani and fried fish down my throat at my grandparents' place. Can you blame me? My nan's cooking is awesome. I swear I felt a bone get lodged in my throat. I start making a scene, saying it's stuck, it hurts and I can feel it. My poor grandparents are now worried. I drink 1.25 L of Coke to see if I can flush the bone out. I swear it feels like it's still there. I'm about 20 years old at the time. Smoked a few spliffs to that night. Indians eat dinner at like 10 PM, so there's no clinics open at this time, so I drive down to the hospital. I tell the emergency front desk staff I have a bone stuck in my throat. Lol. I feel ashamed. Anyway, it's not a real emergency, so I sit there in the hospital for 4 hours. DRs come to check on me finally. I tell them I got a bone stuck in my throat. They have a look. They say nah mate, no bone stuck in there, but it is inflamed and raw and all the coke you drank must have irritated it. I still feel ashamed till today, making my grandparents worry. They called my parents and all the aunties that night to tell them I went to hospital and that I was an emergency point. Everyone in my family said I faked it for years to come. Sometimes I wonder if I wasn't so blazed maybe I wouldn't have exaggerated so much. Point anyway, an F on my part. I have had a couple. One guy got injured at work about a month ago but still showed up to get his sick leave by hobbling on his injured foot. The initial diagnosis was just some abrasions and he should be fit for work. I declined his request, and before setting the next patient, I went for a tea break. From the first floor tea room window, I saw the same guy walking normally to his motorcycle and started it without any difficulty. 2. Hospitals here are almost 95% subsidized, so this 50-ish lady decided to game the system. She claimed to have asthma, but clinically I couldn't find any symptoms or signs to support that. So I gave her some nebulized saline and told her she was fine. She immediately displayed an audible wheeze which surprisingly stopped whenever she had to answer my questions. It seems she uses this tactic to get herself admitted to the hospital and enjoying the free meals for a few days. 3. This guy came in one late afternoon saying he fell off the back of the truck. I did the necessary and he was cleared of any serious injuries or disabilities. So he was treated as having some soft tissue injuries and I gave him a sick leave for tomorrow. The very next day, he came back early in the morning. I attended to him, and he recounted a different scenario, albeit a slightly worse situation, all the while oblivious that I was the one who saw him only yesterday, in an attempt to get a longer sick leave. The look of his face, when I asked him why the story was different as he hurriedly exited my room, was priceless. My nurse and I kept laughing for a good 5 minutes. So not a doctor, but a nurse. Anyway, before I trained as a nurse I worked for the NHS 111 service. It's designed to be a medical helpline essentially for non-emergencies, but we always got our fair share of emergency calls 2.0. One night was particularly rough. I'd had the usual small children with coughs and colds, someone with a rash that was unconcerning but wanted advice, followed by a teenage girl who'd been attacked on her way home. Mum had rung, and she'd collapsed whilst on the call and I needed to give CPR instructions over the phone. Next call was a suicide attempt that the person was now regretting and was ringing for help, arranged an ambulance, and stayed on the phone with her until it arrived. So yeah, rough, and I was hoping the rest of the calls on my shift would be straightforward. Then I got a call from a woman who was saying her teenage child felt unwell. At the start of the call I took down as symptoms when they had started etc. and began to start questioning her to work out how we could help. The initial complaint was mild, and the way the system works is it guides call handlers to triage the patient, and using common sense and the patient's answers we then tell them whether they can care for themselves at home, we can book them an out of hours GP appointment, etc. As the call went on, it became clear to the mum that I was probably going to advise at home care and to see a doctor in the morning. Suddenly new, very dramatic and previously unmentioned symptoms started popping up. I questioned and probed, and had a fairly good idea that she was exaggerating based on her answers, but I'm on the other end of a phone. I can't see her kid, so I have to take her at face value. I pop her on hold and discuss it with one of the doctors on duty that night, who says that to be safe we should send an ambulance. Cool, I get what you're saying, we can do that. So I come back and say to the mum I've had a conversation with a doctor, I'm going to send an ambulance and the paramedics will assess on site and work out whether he needs to go to hospital or not. The mum's quite rude to me, making remarks about how I should have just sent one ages ago. I'd wasted their time, I was to blame if his son got sicker whilst waiting etc. I feel bad, and at the end of the conversation start typing up my closing notes and leave it to the mum to hang up. Seconds before the end of the call I hear her shout to her son, who is clearly in another room at this point, quick, turn off the TV, get in bed and look ill, they're sending an ambulance round. And then she finally hung up the phone. Frustrated was not the word. As practitioner here, I've been working on ambulances and in hospitals and emergency rooms for about 20 years. If I had $1 for every patient I've seen faking a seizure, my student loans would be paid off. Good lord. Some just want a benzo high. Some just want attention. Some are just assholes, wanna know how to spot a person faking a seizure. If they are talking. If they respond to commands. If they remember the incident. Wanna know how to physically test if they are faking. When they are having their seizure, lift their arm up. Most people faking a seizure will let you. Real people having seizures aren't pliable because they are posturing due to muscle spasms, but that neither here nor there. Anyways, lift that arm up and put their hand over their face, like right above their head. Shake it for a second so their arm is really loose. Now let their arm go. A real person having a seizure will hit themselves in the face. It's kinda funny, if a bit sad, but you now know that person is having a real seizure. A conscious person will not hit themselves in the head. They will swing their arm down, to the side, above their head. Anything to avoid hitting themselves. They won't even think about it. No one wants to hit themselves in the head with a limp arm. Even if someone lets themselves get hit in the face, a conscious person will flinch. It takes less than 3 seconds and separates real seizures from fake ones and atypical seizure presentations. Now you know. I was a behavioral health nurse on an inpatient unit. There are several different kinds of seizures, but the one that people fake are grand mal seizures. Think about what a seizure looks like in a movie and then watch this video of a grand mal seizure. Dramatically different. You can see the start of what's called the postictal period too. This is where a person is lethargic and disoriented, and most people don't know to fake it. This information is important to understand why the faking it was so bad. A patient walks in front of the nurse's station, puts her hand to her head, and then falls to the floor, protecting her head and crouching down slightly to lessen the impact. She then wiggles around on the ground with about the same motion of someone petting a dog, moving her arms and legs, but not her head or torso. We gather around her and then do the arm drop test just in case. If you put a person's arm over their face and let it drop, a conscious person will protect their face by letting the arm fall to the side of the head, and an unconscious person doesn't. She protects her face. We all have to restrain our amusement as she wakes up from it and is back to normal. What happened? Did I have a seizure? No posticle period. Also, as a sap, if a person has a seizure, do not put anything in their mouth. They are not going to bite off their tongue. What should you do? Protect their head as best you can by removing anything it is hitting or placing something soft like a pillow or rolled up jacket against it. Roll them to their side in case they vomit, but don't restrain their freedom of movement. Call emergency services. I don't know if this fits this topic, but I got a scar on my back due to somebody fake blind point. Every time I go to Vietnam to visit my family, I would get a massage from the blind people. They are absolutely great! 2 years ago I had this one massage therapist who, according to my family, is only somewhat blind or fake, if they want to put it bluntly, because they've seen him doing things blind people couldn't. They say when he notices people around he would change his behaviors as if he's blind. Like he would be walking normally, and even pretty fast, then someone approaches him, he would slow down and act as if he's trying to find his way. And many other examples. I didn't mind, as long as they do a good job. And he did. My back and neck pain went away, but, towards the end, I wanted to do cupping. They burn the inside of a cup and put it on your skin. The heat sucks out toxin from your pores. The least I understand of the method, plus I've had it done many times, so I'm no stranger to it this time. During the session, a piece of cloth that he used to burn the cup fell off and landed on my back. I was lying down on my stomach, half naked, so my reflex wasn't to jump up. Plus I have the cups on my back. I was pretty much in a vulnerable position, so I could only shake my body hoping it would fall off my back point. And this guy was so committed to his fake blind act that he pretended like he couldn't see where the burning piece of cloth went. He let me struggle for about 10 to 15 seconds until he found it and swiped it off my back point. I still have the scar on my back. Fermulan, not a doctor, but the story is very personal, so I'll share away. My sister-in-law started having really bad headaches. A few weeks later she faints. They take her to the doctor. He says the vitals are okay and it's probably nothing to worry about. So they head back home. She faints again, and again the same diagnosis, but to be safe the doctor recommends some tests. The tests are clear as well. She is discharged, but a few days later she faints again, so she is admitted into the hospital and the doctor carries out a detailed assessment. All kinds of scans, but he can't seem to pinpoint anything. So he once again discharges her, so they get a second opinion, because they feel the doctor is incompetent. But 3 more doctors gave the same feedback after seeing her reports. Note that the crazy headaches are still going on. Then suddenly she goes partially blind one day. Everything is a blur, she said. They rush her to the hospital, but you guessed it, it's all fine. By this time she had started blogging about her condition, saying it's some kind of rare neurological disease that no doctor has been able to pick up on, matching her symptoms with the movie Brain on Fire, and that is what she is going through. She gained a lot of support on her blogs and her condition only got worse. She went completely blind a couple of times and was barely able to talk most of the time. She would occasionally update her blog though. Anyways, one of the doctors suggested that her symptoms seemed to be more psychological and less actual, so he recommended a therapist, and she was then sent to therapy and all her symptoms disappeared. Junior doctor in the night shift at around 2 am. Young boy of 11 years age comes to the department with sudden severe chest pain. History was short and acute. Pain would come intermittently in bouts. Severity was so much that the boy would hold onto his chest and sit up in his bed. Chest pain bouts were accompanied by shortness of breath as well. Past medical history revealed a fracture of the radius 10 days ago. 6 to 7 trainees from different departments. The whole was struggling with the diagnosis. Echo, chest x-ray, ECG was normal. Borderline elevation of D-dimers. CTPA turned out to be normal as well. Admitted to the pediatrics department. 3 consultants saw him in the morning. Scared him with surgery and the bouts of chest pain suddenly ended. Sent home without any treatment. Edit. Adding another case, since these are very common. Night shift in the ER. Female rolled in on a stretcher by her family members. Acute history of fall and unconsciousness since yesterday. Patient in severe spastic paralysis. Wouldn't move a muscle. Severe pain stimulus applied to check GCS and the patient wouldn't move. Eyes open and no verbal response either. Team was suspecting tetanus or a brain lesion. Sent a plethora of tests and each and every one came back negative. Turns out the female had found out about her husband, who had slept with another woman. She walked home on her own 2 feet a couple of hours later. In the opposite light, my doctor thought I was faking an illness. I had horrible stomach cramps that passed on their own and a feeling of general unwell that I stayed home from school from. Since he knew my mother and brother were both addicts, he generally refused, and still refuses, me medications or gave me really generic stuff like Pepto-Bismol and Gravel, which, unsurprisingly, didn't help. After a while I started going to the ER for intense abdominal pain, but they took it as faking, since I was generally okay while I was there. I was used to the pain by then, so yes, I would sit there pretty well for the 8 to 10 hour wait. Usually by the time I was seen the pain had actually passed, after 8 hours. Must have made it look like I was there for painkillers. The ER doc started to call my family doctor about how often I was in for pain, and told him to do something. He decided to do an ultrasound to prove there was nothing wrong. I had a lot of tests done prior, but could never do them, because I was too sick to swallow sheet on demand like barium. I would get nauseous, and since I have like a phobia of vomiting, I just wouldn't finish the tests, which annoyed them. But during the USA find gallstones took out my gallbladder, and I've been fine since. Who would have thought? The 8-hour pain was from physically passing a stone, so once it passed I was okay. My last year of high school, my marks jumped from 60s to 90s, because I wasn't homesick all the time. I'm still salty over this, because anytime I have any symptoms, he immediately thinks I'm faking something. When he refers me out of spite, after complaining for years, they always end up finding something. Obligatory, not a doctor, but a nurse. I came on during a morning shift one day and we have a young fella that came in for an infection. He just immigrated from overseas not too long ago, and he had a liver abscess that needed to be drained, which was scheduled for the next few days. I walk into the room to hear whimpering and crying etc. and asking for more pain meds. Now he had a dose not too long ago, and we are only allowed to give it every 4 hours, unless he gets reviewed by the drive. During the first hour he keeps asking for more pain meds and complaining of 10/10ths pain, and in the hospital I worked at, that pain score is an automatic clinical review from the medical team. I felt bad for this fella, and not being able to do anything when someone is in a lot of pain is tough. So the doctor walks in and suddenly, it is too painful for him to move, and he starts struggling to talk and starts hyperventilating. I told the doctor what was happening etc. and mentioned how he seemed to have deteriorated rapidly. When she stepped in, he was charted forth morphine, and after giving it to him, he kept saying it didn't work and continued to ask for more / something stronger. He was told to wait for it to take effect. Anyway, a while later his girlfriend comes and visits him. He was due for his 4th antibiotics, and I had to do another set of vital signs on him, so I go towards his room and I stop short of the curtains which was drawn, and I hear him talking normally. I open the curtains, and he stares at me, and then proceeds to hunch over and start whimpering and crying again, saying that the pain is back, and if he can have more pain meds no doubt he would have been in some sort of pain, but it was very over the top. I genuinely felt really bad for him, and felt cheated emotionally. Not a doctor, but I have my BA in psychology, and I'm working on going to graduate school. I believe my maternal grandmother has very severe factitious disorder. Since before I was born, until I was 18 years old, now 24, she was homebound with life-threatening allergies to scented items, latex, alcoholic beverages, nail polish, countless other items, as well as asthma, diabetes, narcolepsy, congestive heart failure, and who knows what else. She was hospitalized on numerous occasions for anaphylactic shock from her allergies and again would not leave her house unless it was for a doctor's appointment or to see family. Even then she would wear these cotton masks around her face. One time when I was very little, I do not remember what age, she passed out at the kitchen table with me in her lap while she was pouring me a glass of apple juice. The ambulance came and brought her to the hospital. I find out years later, from my mother, that there had been nothing wrong with her that night. I was too young to go to the hospital with her. When I was 17, my maternal grandpa became sick with pancreatic cancer that would eventually kill him about a year later. My grandma completely stopped caring for herself and him, acting like she could not remember anything, and she would wet herself in the bed, anything to get attention, while my grandpa was slowly deteriorating from cancer. After my grandpa passed, all of my grandmother's allergies went away, and she went places with us all of the time, restaurants, malls, etc. She even started drinking with my parents on occasion, something I had never seen her do before. The real kicker is that one year in my mid-childhood, my grandpa received one of those fake mounted fish that sing when you press the button. Because he was an avid fisherman and hunter, he had his own fish and ear mounted, and even had a bearskin. Since I was a kid, I played with that fish until it was probably unbearable for the adults to listen to, and it disappeared one day. I found out, when I was 19, after her allergies had disappeared, that singing fish was made of latex, meaning that she should have had a major reaction to it. We couldn't even have balloons around her. She never reacted to it, because she didn't know it was made of latex. For years she lied about her medical issues, and how people at her job at the VA aggravated her allergies, and did not take them seriously, almost killing her. Also, after my grandpa died, she accused my parents of stealing from her, and they plead guilty, and are now felons because of it. We were taking care of her, and fixing up her house. She attracted sympathy from people by acting like she had dementia. The doctors predicted that her early onset dementia was so severe that she only had a couple years left to live, until about 2016. Well, she is still alive, and I haven't spoken to her in 5 years. I was a therapist at a community mental health clinic. I was working with a client I was convinced was faking it. The woman who performed his intake assessment was more qualified than me, so I didn't question it too much. I started going to the psychiatrist appointments with this client, and he brought up his bipolar depression, which is a fairly unusual phrase to use. He mentioned it several times over the next few appointments and some symptoms that just weren't adding up for me. I glanced down at the doctor's latest psychiatric journal with new treatment for bipolar depression. At the time, all bipolar treatments were indicated for mania and depressive episodes were treated with standard depression regimens. Several years ago, a drug was FDA approved as the first specific treatment for bipolar-related depression. I suspected this is where the client got the idea. He repeatedly asked for Wellbutrin to be prescribed. This medication acts on dopamine, and when crushed and snorted, non-XL, can create a cocaine-like high. This wasn't just drug seeking though. He was faking mental illness and intellectual disability to gain money from the government. At the time, he was not only getting psychiatric treatment for free therapy and free medical care, he got $225 a month in food stamps, $800 paid apartment and utility fees, and $725 from Social Security. I finally confronted the medical director about his malingering. Then he got arrested on an unrelated change, and I didn't have to worry about him anymore. Not a doctor, but a scientist. Two different friends faked illnesses to me. The first I worked with at a nightclub. I said I needed to leave as soon as we closed because I had uni at 9 AM. She begged me to come to Artis with her because she fancied the particular celeb performer who was the guest that night. After a few hours I tried to leave. She got really upset and begged me to stay, to which I kept repeating no. She had a seizure. Our supervisor called an ambulance, and she was kicking off at them and running away. I was so embarrassed. I told them just to leave, and that I was really sorry. When I finally found her, I told her I really needed to go, but she could come home with me, so I could monitor her. Nope, she wanted to stay, and started seizure her again. My supervisor gave me £20 to put us in a taxi to the hospital. She started again outside the hospital. The nurses basically told me that she was faking, and I was pissed. Now it's like 8 AM, and I'm gonna be late for uni. She wouldn't contact her mum or anything, and begged me to stay with her. When she went to the vending machine, I took her phone, copied down her mum's number, and her mum picked us up and dropped me off. We are not friends anymore. The second one, I cannot even begin to explain how many times she'd faked family terminal illnesses, and when I caught her out she'd suddenly tell me about this brand new surgery that cured her mum instantly of stage 4 terminal breast cancer. So anyway, I went to visit my parents for the weekend and she decided that night to fake an overdose when my other housemate called me crying while it was all happening. So I come straight back home to help look after her. She tells me that the paramedic had counted 60 paracetamol in her 60 there, and then I knew it was bullshit. She caused so much distress, her family traveled 900 miles to the hospital. In the aftermath, she asked if I could help sort out all of the doctor's stuff. I read the letter that the hospital had sent to our address. No mention of an overdose or anything, just a whooping cough. Not friends with her anymore either. I have a few good stories, but the mother of them all, historically speaking, was the Indiana Cyclone, a supposed former pro wrestler who terrorized hospitals across the country in the 1950s and 1960s with factitious hematosis, coughing up blood. He specialized in faking pulmonary embolism in an era in which definitive diagnosis of PE was challenging. They used to keep track of him by writing letters to prominent medical journals, especially JAMA, the chair of medicine at Iowa, where he took up a tumultuous inpatient residence in 1954, wrote a long poem about his shenanigans, might be paywalled. Several highlights, had many surgical scars, claimed to have had an appendectomy on an Irish tugboat and bilateral renal explorations in Japan. Recent incisions he attributed to a car accident in San Francisco, though he had actually had his IVC ligated in Salt Lake City a month prior. After initially changing his mind on the table and storming out of the OR with an epidural dripping, wearing his surgical drapes like a toga, once accused of self-phlebotomy after needles found in a ward toilet, retaliated by tearing his chart into little pieces and flushing it. Really like Demerol. Became violent, started destroying furniture, then tried to sever his femoral vessels with scissors. I'll get the clots out myself. He kept the staff at bay with a chair until he passed out and was rushed to the OR. Wallet searched while he was under anesthesia, found to contain many cards/papers with names and addresses of various hospitals and doctors committed to a psychiatric hospital where he escaped. Followed by JAMA correspondence for years, ultimately believed to have died in New York in the 1970s. Not a doctor, but pretty extreme case of faking it here. A couple years ago, my girlfriend's roommate was actually psycho and was surprisingly good at hiding it. I'd known the psycho girl, I'm gonna call her Z for clarification, for a while before even meeting my girlfriend, but as long as I'd known Z, she was always recovering from some injury or some kind of abuse. And I mean, all of it was weirdly believable, because she was so charismatic and friendly that everyone just naturally assumed that Z was a terribly unlucky sweetheart. Also, I don't know about any of you all, but if someone tells me they've been abused, maybe my last thought is to question their integrity. Now about a year into knowing Z, my girlfriend and I started a serious relationship, and at pretty much the same time my girlfriend moved into the same single room dorm room as Z. Oddly, Z's previous roommate apparently mentally abused Z and also dropped out of school because she just snapped mentally. A couple weeks into Z and my girlfriend sharing a room is when things started to get odd. My girlfriend started complaining, pretty much daily, about how Z would just flip out of nowhere, then leave and disappear for a while. I just told my girlfriend, it's probably from all the past trauma she's had, you can't go hard on her. It wasn't until I started to get annoyed by how much my girlfriend was complaining that she mentioned whenever Z went away, she would always say something very dark, usually suicidal, then say if anything happened to her, Z, while she was out, it would be my girlfriend's fault for not saving her. Also of note, my girlfriend had something of a savior complex where she believed if she had the ability to help someone in whatever way it was, she would put all of her effort into helping that person. Kind of became toxic here. It was at this point I started to become very suspicious of everything Z did. My girlfriend begged me not to do or say anything about it to anyone because of all the abuse stuff that was very personal. Bad move I know now, but I loved my girlfriend at the time. There was nothing I wouldn't do for her. Another bad move I know. So, instead of going to someone, I started to call Zed's bluff on a lot of the stuff she did. That is, what hospital did you go to get an x-ray for your broken arm? Oh, I didn't go to a hospital. I've broken so many bones, I know what it feels like, so I just bought this on brace myself. After I started doing this, she tripped in front of me once and blamed me for giving her another concussion. A lot of people were pissed at me for hurting the poor sweetheart. The weirdest thing that happened was, once afternoon my girlfriend and I were watching a movie and just chilling in her bed when Zed and her new boyfriend busted in and start hardcore making out on Zed's bed. Very bold of them, but we didn't really care, so we just tried to ignore them. After a couple minutes of them lip smacking, I get that feeling I'm being watched. Against my better judgment I look over, and Zed is staring right the fuck into my eyes while macking this dude. Just a constant stare. I gave her a mouthed what the fuck, and she just kept on staring, so I just got up, told my girlfriend good night, and got the hell out of there. About 6 months roll around, and my girlfriend is actually starting to lose it mentally. It got to a point where, if Zed wasn't around my girlfriend 24/7, Zed was threatening to harm herself, or just run away. Very much taking advantage of my girlfriend, and even though my girlfriend knew she was mad, she still thought she could help. I felt like I was losing my girlfriend to Zed, so I started telling some of the stories to my friends, and some people actually start believing that Zed may not be the angel everyone thought she was. Then, Zed dropped the bomb on us. She told us all she had a terminal brain cancer and couldn't afford proper treatment, and her parents refused to do anything to help. She'd be dropping out of school at the end of term. Everyone's immediate reaction was back quote, "Oh damn, that's why she'd gone crazy." One night my girlfriend was raging and straight up called Zed parents to ask how they could just let their daughter die. Mind you, her parents apparently abused Zed as a child and kicked her out of the house. The parents said none of that was true and they knew nothing about Zed having cancer. Turns out the parents were already helping Zed financially, and they said Zed is a bit of a compulsive liar. This more or less drove my girlfriend mad. We tried to tell everyone, but no one really believed us, because who are you gonna believe? The terminally ill angel, or the abusive parents? Plus we couldn't contact the doctors she was going to get proof because that's confidential, and she'd take the labels off every pill bottle she had. That's how desperate we were to find proof. In the end Zed ends up saying her tearful goodbyes to everyone and leaving. My girlfriend was just mentally broken by it all and became very uncomfortably dependent on me after that. We broke up a month or two later. Everything kind of settled down after Zed left. Then, about 6 months later, we get word from Zed's family over her social media that it all was a lie. She never had cancer. She's maybe broken one bone in her life, not the 15 or so she used to say. She really never had any serious concussions, and she was never abused by her family. Zed was now just living a fairly normal life in the Midwest, though she did try to creep back into people that still believed hers lives. Strange woman. Long story. And I don't know if I can say I'm a better person for having lived through that. TLDR, my girlfriend's old insanely charismatic roommate manipulated everyone into thinking she was an unlucky angel who was constantly being injured or abused in some way. When people became sus, she lied about having terminal cancer and then moved away. I sometimes wonder if my grandma would still be alive if her rehab physicians had listened. Maybe not. She was 82 and had lung cancer. She'd already gone through chemo. The cancer didn't go away, but we didn't really get a definitive answer as to whether it had reduced in size, etc. They also found the cancer in both lungs, but they weren't positive if it had metastasized or whatever you call transferring through the blood, etc. She had been a smoker. Anyway, she'd been really sick and kind of stopped eating. She ended up in the hospital for a week, but after a week they said she wasn't sick enough to stay, but she wasn't fit to go home, so they sent her to a nearby rehab place. She was there for a few weeks, and she was not happy about it. I couldn't blame her. She just wanted to go home, but she lived alone, so it wasn't feasible yet. While she was there she got really irritable and was rude with the staff. Probably because she felt shitty, and I think she was scared she wouldn't get to go home. At one point I think the nurses kind of got jaded because of her attitude and rudeness and stopped paying as much attention to her. Eventually she got more obstinate, yelling, "Don't you know I'm sick? I keep telling you I'm sick." They'd take her temp ETC point and say she was fine. Finally my family insisted she get blood work done because she was so insistent. Turns out she had C. diff. She'd has lots of antibiotics during her hospital stay and was immediately sent back to the hospital where she quickly deteriorated more. She died about a week later. I know it's pointless to what if or to try to place blame. She had so many things working against her at the time. But I can't help but wonder if she wouldn't have died at that time if they had caught the infection. How do you miss it when the person keeps telling you they are sick? But I think after a while they thought she was just being mean for the sake of it. Funny that both times I was admitted into the hospital for psychiatric reasons, there was a man who was there for both times as well who was the exact same dude. He was a homeless dude from what I had gathered about doctors talking about him, and that he came in pretty regularly. A druggie as well on top of everything, because he kept on asking for pain medication as he was in pain. Nurses would give the first dose, but the doctors fought him with not giving him anything more as much as they possibly could point. So you need a clinician to come talk to you about how you're feeling before they decide if they'll admit you into the mental ward or not. And both times the clinician straight up said, quite loudly, we were in a room full of 7 to 8 beds, some of us waiting to get admitted and some of us waiting to be seen by the clinician, that he was faking it and needs to get his life together essentially. The guy would be offended by this both times, and also a doctor from the ER that was there both times also said the same thing to him, and would tell other nurses he's tired of seeing him here, because all he wanted I guess was hot food, snacks, and a place to nap. Now where I'm at, there are homeless shelters, and not an overwhelming amount of homeless people like out in the main city, but I'm assuming he chose the hospital to get his fix in as well on top of food and a bed. Point I was there last year, first in the beginning January and then the second time at the end of April. Dude keeps getting away with it since they really can't deny him I guess. I don't know how those rules work, but he found a loophole. I have a story from the other end to tell. Point woke up on a Wednesday morning with a sore throat. Went to see my GP because I had a scheduled appointment for another chronic issue. Point Wednesday evening I got a fever, a high fever, and I coughed so bad I was throwing up from it. Point Thursday was a national holiday and my parents went and fetched a new puppy from the breeder. He was an accidental breed from our friend's dogs, and I was so weak and feverish and in pain that I couldn't even go down the stairs to welcome the puppy I had been so excited for. Thursday evening I couldn't breathe properly, kept coughing and throwing up, and the fever was so high my mother, a nurse, drove me to R&D. Had to put me in a wheelchair because I couldn't walk far enough. Point the doctor there laughed at me because it isn't possible to throw up from coughing and told me I just did not want to go to work. Point Friday I went to see my GP again and I passed out and seized from the fever. Also my lungs were full of fluid. Back to the hospital where they put me on oxygen and gave me a lung x-ray. I had a really bad case of influenza and beginning pneumonia. This was not the first neither the last time I was accused of faking it until they learned that I actually wasn't. Bit of a long story, but I promise it has something to do with faking it in the end. Point had a young lady who would present to emergency several times a week after swallowing razor blades or inserting them rectally. Initially she would complain of severe abdo pain which was not in keeping with her examination, blood tests or basic imaging. We still had to refer her to the gastroenterologists and general surgeons because of the obvious risk of perforating her gastrointestinal tract or bleeding. She eventually became very well known to the specialist teams who were fed up with having to see her so regularly and often not needing to intervene. After close to 100 similar presentations we had a multidisciplinary team meeting and established specific criteria, and when we had to refer her to the surgeons, gastro, mental health or home. Point she continued to present to emergency and started missing the regular attention of the specialists. Over time she did have 2 significant bowel perforations requiring surgery, but otherwise was managed conservatively. She eventually learned how to fake the signs and symptoms of peritonism, signs of peritoneal inflammation, a surgical emergency, so convincingly that even the surgeons thought she needed surgery. She was able to maintain tachycardia, sustain a rigid abdomen through all sorts of distraction techniques, and even had a raised lactate level from time to time. She was taken to theater emergently several more times and there were no issues found. In the end, she has subjected herself to multiple unnecessary laparoscopic surgeries and tons of cord scans, as well as the razor blades. For a young lady, TLDR, fakes abdo pain so well she gets multiple emergency exploratory laparoscopies. I'm not a doctor, but I have a hilarious story to tell of my ex faking it. So my first abusive ex is a compulsive liar. She would lie about anything, big or small. She lied about a serious spinal medical condition until I found her medical report that states she does indeed have an infusion of only to lower vertebrae, but not TGE condition she claimed to have. After I discovered this, she immediately quit her bullshit, but only for about a year. It was a long time ago now, but she basically claimed to have a much more severe condition involving her whole spine. She used this to get out of practical lessons in college, but what made me suspicious is the fact that she always carried around the heaviest backpack. I had to go through her bag to sort out what she needs and doesn't need, just to lighten the load, with consent, of course, and it did stop her complaining about back pains. However, after finding the note, she stopped using her back as a way to not do practicals, and she stopped using it as a way to not do any work outside of college. It was a miracle. The story with the doctor starts here, though. One day, she laid on the couch, way after the spine life fiasco, complaining that her back hurts and she can't breathe. I lifted her backpack, and wouldn't you know it, it was really faking heavy. We went to college 3 days a week, which she would carry this faking thing all the way around for the 8 hours each day. But she also carried it everywhere she went outside of college, meaning work, too. I'd carry it at times, cause I'm not a dick, and would prefer to keep her happy and healthy. Anyway, I left her bag alone, didn't empty it just in case. I left her alone on the couch, cause I knew she was over exaggerating. Yeah, I know, I was a dick. Honestly though, after all the abuse, lies, and the many times she wouldn't accept a breakup, I just kinda gave up caring, but I could always tell when she was lying. She's a terrible liar. Later, my mother decides we're taking her to the hospital. Apparently she wouldn't stop moaning. So we went. My mother dropped us off, and we waited in the waiting room after checking in at the desk. The beginning was still the play, but I explained again that it might just be the bag. She still wouldn't agree, so we sat there. I gave her love and attention, and we had normal love chit chat. I kept observing her BPM, breaths per minute, and noticed that they lowered from quick and short to normal while she focused on talking to me or playing games on my phone. They immediately came back when we were called, though. She wanted me in with her as she was nervous. So I went in with her. She talked to the nurse about her difficulties, no mention of back pain this time, while I held her hand. During the ECG, I stopped holding her hand of course, and I had to quickly shush her when she wanted to speak, not rudely, it's just because vocal vibrations can alter an ECG's results. And then there was the stethoscope BPM observations, etc. The nurse seemed to be sure there was an issue, but then some people would agree with the casualty to avoid confrontation. She said she'd have to get the doctor, and left. My ex then rubbed it in my face that there was something wrong with her after all. I was never nasty to her. I was loving and caring throughout, after trying to help in the beginning, but not giving too much of a shit. So this was unexpected and kinda ticked me off, but I stayed calm. I still gave her love, care, and attention, but told her politely that we'd still have to wait for the doctor. The doctor arrived with the results and asked my ex a few things. My ex's face was a sight to behold. She couldn't answer anything he was asking because he was asking questions that obviously implied there was nothing off with her results. Meaning there was nothing wrong with her at all, and I was right. Anyway, he asked the questions he needed to ask. I don't remember the exact questions, but they were basically what have you been doing recently? Have you been doing any strenuous exercises? Etc. And she couldn't answer. Then he asked me what I thought could be the issue. I hadn't spoken to the nurse or doctor until this point, bear in mind. I told him about her backpack. The backpack that my ex brought with her to the hospital. He said that is the most likely cause of her discomfort, and advised I carry the bag for her, and empty any unnecessary items to make it lighter. I agreed, and we were dismissed. My ex's face was the ultimate face of defeat. I didn't rub it in her face though, like she did to me. I actually hugged her, grabbed her bag for her, and walked out with her, holding her hand, and ensuring her she'd be okay. Basically just being a loving and supportive boyfriend. We were engaged, but fuck the spelling. I don't remember which one F and K is, and so on. She stopped the rapid breathing, and complaining of breathing difficulties after this. Although, she actually stopped just before the doctor came in the room. So yeah. Thanks for reading. During my surgery rotation at the when I was still a junior intern, we get a lot of weird patients. This one is the most memorable. This is a weird faking it story that isn't really faking it but can be. You'll get what I mean later. So, about 11 PM, an unknown man was brought by a passerby into the because he was on the road screaming for help and that he got stabbed on the feet. He's a small guy about 5'6" with medium build. Came in shirtless, barefoot, screaming, in severe pain, and was cursing a lot. Oh, another victim of snatchers. That's sad. He was put in the critical bed immediately. We surveyed and saw that there was some blood on his feet. He was quite dirty too, so we cleaned him up to find the stab wound. But, after cleaning, there was actually none. The blood came from a few gashes on his feet, but no actual stab wound. He kept on panicking and screaming, "Ouch, it hurts a lot. And I'll kill you. Insert name here." Insisting he was stabbed here and there, and kept moving a lot, so it was hard to treat his wounds. I'm a 5'2" Asian girl, and I was trying my best not to get punched or kicked by him. He also smells like alcohol, so we thought he might be terribly drunk. We decided to insert and force to hydrate him, but he's fighting back. We are hurting him, and wanted to harm him. He was screaming names, and cursing a lot, that he was put into the isolation room, and was restrained before one of us gets punched. At that point, we can't really do anything to him. The man who brought him didn't have enough history, and there's no ID, so the head nurse just called the police and we waited. We thought keeping him in the isolation would be safe, but, about an hour later, when he was let out to pee, he came running and shouting at the first person he saw, which is unfortunately, our cardio fellow. We were scared, cause he could punch that little lady anytime. He was escorted by the nurses and guards back to the isol again, but he was fighting hard to the point that he laid on the floor and threw a massive tantrum. It was like watching a movie tbh, frustrating yet entertaining. Thankfully, the police arrived and brought him out in handcuffs. The head nurse later told us that the guy's probably under the influence of illegal drugs and was terribly drunk. I felt bad for the guy who brought him. He was just being nice, but ended up bringing a bad apple. Not really the biggest case, but just another day in the office for me. I'm an occupational health physician, company doctor, catering mostly to BPO agents / call center agents / customer service representatives, and part of the job is to sniff out malingering patients' conditions to sending the patients home, or the is stringent, since team productivity needs to meet their everyday call quota. However, it's a known fact that an agent can go home with a paid leave if he loses his voice, since he's no good as a call center agent. Most agents try to take advantage of this and pretend they can't talk. How do I know who's lying? I just chat them up, joke around, ask about their day, anything to lower their defenses, and make them talk 8/10, eventually reveal their perfectly normal voice. You can't pretend to have a hoarse voice for long. Then I just say, "Oh, your voice is back. I guess you can go back to work now." Agents can also have paid leaves for infectious conjunctivitis. You will be amazed at the lengths that some will go just to make their eyes look red, from rubbing them vigorously, to putting their eyes under running water, to putting an actual irritant, alcohol, iodine, just to take a faking day off. I just give them an hour of rest at the clinic, and if they really have conjunctivitis they should have some form of discharge forming around their eye. Otherwise it's self-inflicted, and it's back to work for them. If the agent complains of severe diarrhea, I just check for objective signs. If he's really gone through 10 loose bowel movements in 4 hours, it should show in his pulse, blood pressure, hydration status. What patients don't seem to realize is how we can see through them with mere vital signs and physical examination. Chiropractor here. I often get high school or university students looking for a note either excusing them from gym or that their back pain prevented them from studying/taking a test. Point for the high school kids. It'll do my list of authors plus neuro tests and dare them to do the activity until it hurts. Most of the time it's running or doing squats. They will often still be unable to do X. So I treat what is needed and write a note for an excuse to not do X, but not to restrict other activity, and it will have no more than a 4-day time span, unless I'm certain they actually need it. My last one said he couldn't do squats because it hurt around his knees, so I had him do squats until the pain showed up, took 3 squats, checked for some common knee issues in his A group but nothing was positive other than tender/sore muscles, did lots of deep massage/Graston, stretching and a few spots that needed adjusting. Gave him 3 days from squats, but put in the note he can do any upper body exercise and power walk 4 runs. His mom is a patient of mine and told me was back to normal a few days later. The way he reacted to the pain and his poor ability to describe its location made me think it was just a get out of gym card. Point I've only had a few university kids try and get a note from me. One saw me 2x in a week, came back a month later asking for a note to say I saw him a month ago. Not sure why, I'm assuming it was test or quiz related in some way. He would only say that he needed it for school. I was also new to practice, and it was my first note and didn't think at the time to ask more into it.